Okay, so picture this. You're driving down the road, and suddenly you see flashing lights in your rearview mirror.
Oh, yeah.
An ambulance flies by siren, blaring.
Uh-huh.
And in that moment, I know for me, my heart always skips a beat. I start thinking about, the person in the ambulance, the emergency unfolding.
Yeah.
But have you ever stopped to think about the paramedics, the ones behind the wheel rushing to the scene? How do they make those split-second decisions? The ones that could mean the difference between life and death.
It's incredible, right? The pressure they face, it's immense.
It really is. And today, we're going to get a glimpse into that world.
Right.
We're doing a deep dive into the minds of paramedics.
Yeah.
We've got some excerpts from actual paramedic training manuals, and let me tell you, these things are fascinating.
It's amazing how much goes into those decisions they make in the blink of an eye.
Right, and it's not just about knowing the procedures. It's way more than that. It's like a whole system, a whole philosophy built around patient safety and ensuring consistent high-quality care no matter what the situation is.
Exactly. Every patient deserves the best possible care, regardless of the circumstances.
Absolutely. And one thing that really caught my eye as I was going through these manuals was how paramedics don't always jump right into trying to diagnose what's wrong. They have this system they use. It's called the primary survey.
Right, yeah.
And it's like they're putting together a puzzle, right? They're gathering information quickly and efficiently to guide their initial actions.
It's all about speed and efficiency in those first few minutes. You arrive at a scene and it's chaos. Someone's injured, distressed. You need to act fast, but also, like you said, gather information quickly. That's where the primary survey is key.
So it's not just about rushing in blindly. There's a method to the madness.
Precisely. It helps paramedics identify those immediate life threats and stabilize the patient. It's about prioritizing, figuring out the most critical actions to take first.
Okay, that makes sense. So they're not just treating the immediate problem, but they're also anticipating, what could happen next. And speaking of anticipating, the excerpts also talk about being prepared for potential deterioration.
Right, yeah.
Which honestly sounds a little ominous.
Well, yeah, it can be. It basically means recognizing that a patient's condition isn't static. It can change rapidly and not always for the better. Think about someone experiencing chest pain. It might seem stable initially, but there's always a risk of a heart attack.
Oh, wow.
Paramedics are trained to look out for these potential changes and be ready to adjust their approach accordingly.
So they're constantly reassessing the situation.
Absolutely.
Okay, that's intense. And then there's this term that really jumped out at me, load and go.
Ah, yes, load and go.
Which, it just sounds kind of dramatic, doesn't it?
It is a pretty critical decision point in emergency care.
Right.
It's recognizing when a patient needs immediate transport to a hospital, even if that means foregoing some on-scene stabilization measures.
Okay, so skipping some steps to get them to the hospital faster.
Sometimes, yes. A classic example is a suspected heart attack. Time is muscle. In those cases, every minute counts.
Wow, so it's like a judgment call.
Exactly. A crucial one.
How do they decide, like on the spot, whether to stabilize the patient right there or rush them to the hospital?
It comes down to a bunch of factors. The severity of the condition, the patient's vital signs, potential risks of transport. They're weighing those risks and benefits in real time.
Right.
It's not always a clear-cut decision.
So it's really about using their training and experience to make the best call in that moment.
Right.
And on top of all that, they also have to gather so much information about the patient's condition.
Of course.
The excerpt mentioned all these factors like provoking factors, quality, region radiation, severity, and even timing.
It's like they're detectives building a case, a medical mystery they need to solve.
And they have to do it quickly and accurately.
That's why those specific details are so important. They help paint a clearer picture of what's happening. Okay, so let's break down those detective clues.
Like, what exactly are provoking factors?
So provoking factors are all about what might have triggered the problem.
Okay.
For example, did the chest pain start after exercise or maybe during a stressful event? Those are clues.
Oh, I see.
Then you have quality, which dives into the nature of the symptoms themselves. Is the pain sharp or dull? Is it constant or does it come and go?
Interesting. So it's not just about whether they're in pain, but what the pain feels like.
Right.
Okay. And then there's region radiation, which I guess tells you where the problem is located and if it's spreading.
Exactly. So does the pain stay in the chest or does it radiate down the arm, for example?
Fascinating. And then there's severity, which is pretty self-explanatory, right?
Yeah, it's all about the intensity.
Yeah.
On a scale of 1 to 10, how bad is the pain?
Got it. And finally, timing.
Ah, yes. Timing helps us understand the duration and progression. Did the pain start suddenly, or did it gradually worsen over time?
So they're piecing together a whole timeline of the event.
They are. It's all connected.
Wow. It's amazing how much detail they have to gather while under so much pressure.
It's a testament to their training and skill.
Absolutely. And remember, just scratching the surface here.
Right.
The excerpt also mentioned ALS-PCS,
Oh, yeah.
which, if I remember correctly, hinted at an even bigger system that guides these decisions. Can you refresh my memory on what ALS-PCS stands for?
Sure. ALS-PCS stands for Advanced Life Support Patient Care Standards. Think of it as a comprehensive rulebook for paramedics, a set of evidence-based protocols that ensure consistency and high-quality care across the board.
So it's the foundation for everything they do.
It really is. It covers everything from those basic life support techniques to more advanced procedures.
Wow, so this deep dive has honestly given me a whole new level of respect for what paramedics do.
Hmm.
They're not just reacting to emergencies,
Yeah,
they're
sure.
working within a really complex, highly structured system that's designed to get the best possible outcome for the patient.
They have to think critically, assess situations rapidly, and make those life-saving decisions all under immense pressure. It's remarkable.
It really is. And it makes me wonder about the balance between that need for rapid response and the need to gather all this detailed information.
Yeah.
It seems like such a delicate dance. You have to act quickly, but you also have to make sure you have all the facts before you act.
Right. It's a constant balancing act, and it highlights just how crucial their judgment and expertise are in those moments.
Well, I think we can all agree we've learned a lot today. A huge thanks to you for taking us behind the scenes of emergency medicine.
My pleasure.
It's a world we often take for granted, but as we've seen, there's so much more to it than meets the eye.
Absolutely. It's a fascinating field, and those paramedics, they're true heroes, unsung heroes in many ways.
Couldn't agree more.
Yeah.
So, to everyone listening, next time you see an ambulance racing by, take a moment to appreciate the incredible skill and dedication of the paramedics inside.
They're out there saving lives every day.
It's true. And just remember, what we've talked about today is just the tip of the iceberg when it comes to the world of emergency medicine.
There's always more to learn.
Absolutely. So keep those questions coming, and we'll keep diving deeper.
Great talking with you.
Thanks again for joining us.
See you next time.
And to all our listeners, stay curious, stay informed, and we'll catch you on our next deep dive.
Bye.
See ya. Ever wonder what goes through a paramedic's mind when they arrive at an emergency?
It's a whole different world, that's for sure.
Well, today we're going deep into that world, using a real excerpt from a paramedic standard operating procedure.
Sort of their playbook for handling those critical moments.
Exactly. So, picture this. Sirens blaring, you pull up to an accident scene. What's the very first thing they do? What's going through their heads?
You gotta think triage, right? Like immediate priorities.
Right.
And the most basic one is the patient alive, what they call VSA, vital signs absent.
So no pulse, no breathing.
That kicks off a whole other set of protocols. But let's say our patient's hanging in there, got a pulse. Where do they go from there?
Well, I know they jump into the ABCs, right? Airway, breathing, circulation.
Yep, the fundamentals.
Hmm.
But it's not just a checklist. Let's take airway. It's gotten clear. Obstruction, tongue blocking it.
Oh, yeah. I remember learning that in the first aid class. Would be a real problem.
Absolutely. Then you got breathing. Are those breaths effective? Chest rising and falling properly. These assessments are happening lightning fast.
And there's something about protecting the spine, too, right?
Huge. Every movement could make a spinal injury worse. So right alongside those ABCs, they're immobilizing the head and neck, cervical collar, careful positioning.
First, do no harm.
Exactly.
Okay, so we've got the airway open, they're breathing, circulation's good. What's next? Layperson here, remember.
Now it's about tackling those immediate threats
Threats.
to life, limb, or function. Could be oxygen therapy, controlling bleeding, stabilizing a fracture.
Whatever it takes to keep them alive and...
Minimize long-term damage.
Yeah, I noticed that in the document. It emphasizes not just saving life, but preserving its quality, too. That's pretty powerful.
It is. And that leads us to something people might not think about. Positioning the patient. It's not just for comfort. It's part of the treatment.
Wait, what? How so?
Well, imagine someone with a chest injury lying flat. Could make breathing harder, right? But raising the legs can boost blood flow back to the heart, what we call venous return. So paramedics use positioning to support the airway, breathing, circulation, even protect injured limbs.
Wow, it's like one giant puzzle where every piece is connected.
Bingo. Now, say our patient's stable, breathing well, those immediate threats are managed. Big question then becomes,
Do they need to be rushed to the hospital?
Exactly. Or can some stuff be handled right there?
And that's where the document talks about stable versus non-critical patients, right?
Yep. It's where judgment and experience come in. They're constantly reassessing vital signs, looking for changes.
So stable might just need on-scene treatment monitoring.
While someone unstable or with a serious injury needs that ambulance ride ASAP.
Makes sense. And I remember the document emphasizing this. It's not a one-and-done thing. They stress ongoing assessment, right?
Absolutely. Constant vigilance. They're watching, listening, checking vitals. Because a patient can crash in a heartbeat.
Man, that's a lot of pressure.
Takes training, that's for sure.
One more thing that stood out to me, maybe it's obvious, but the NPO rule. Nothing by mouth.
Ah, good old NPO. Seems simple, but think about it. Giving someone food or drink at the wrong time.
Could be bad.
It could interfere with meds, worsen nausea, even cause complications during treatment.
Never really thought about it that way. So it's about more than comfort, it's safety too.
Yeah.
This whole process, from the moment they arrive to that ongoing assessment, it's incredible. Systematic, but adaptable.
That's the key.
And it makes you realize how much they know, how skilled they are.
Definitely.
So to all our listeners out there, think about this. If you were at an emergency scene, even knowing these basic steps could make a difference.
Absolutely.
Stay calm, give good info, maybe even help with basic first aid until the pros get there.
Knowledge is power, especially in a crisis.
Couldn't have said it better myself.
Glad we could dive into this today.
Me too. Until next time, everyone, stay safe out there.
And stay curious.
We think of oxygen as pretty simple, right? Like air we need it to live.
Right.
But it turns out oxygen therapy, way more complicated than just giving someone air.
Yeah.
So today we're taking a deep dive into the Ontario Paramedic Standard for Oxygen Therapy. And this is basically like the rule book that paramedics use out in the field to make some really serious decisions.
Yeah, for sure.
So this standard, first it kind of sets a baseline, right?
Yeah.
It says that for most patients, you want to aim for an oxygen saturation level between 92 and 96%.
Yeah.
So why that range?
So that's like the sweet spot, you know?
Yeah.
You want to make sure that the body's getting enough oxygen to keep everything running.
Right.
But you also don't want to go overboard and risk causing any harm.
Right, yeah. So 92 to 96. But then the standard says, unless specified otherwise,
Right.
which is where things get kind of interesting.
Definitely. Yeah.
So what are some of those situations where you would not follow that 92 to 96?
Well, there are a few cases where you actually need to crank up the oxygen to like 100%. So think like carbon monoxide poisoning,
Wow.
cyanide exposure,
Oh, geez.
or even like those scuba diving emergencies you see in movies.
Scuba diving. Okay, I did not expect that to be on the list.
Yeah, yeah.
What is it about those types of conditions that need that much oxygen?
It all comes down to how they mess with your body's ability to actually use the oxygen.
Okay.
So like carbon monoxide, that's a tricky one
Yeah.
because it binds to your red blood cells way stronger than oxygen does.
Really?
Yeah. So it's basically like those red blood cells are getting hijacked. They can't carry the oxygen around your body.
So it's like you're suffocating even though you're breathing air.
Yeah, exactly. So in those cases, you need to hit the system with tons of oxygen.
All right.
Try and force that carbon monoxide off and give the oxygen a chance to bind.
So that's why they just blast you with it.
Yep.
I always wondered.
Yeah, yeah,
Interesting. So it's like paramedics aren't just giving oxygen. They're making these really important decisions
for sure.
based on what's actually happening in the body.
Exactly.
That's pretty wild. What about upper airway burns? I saw that on the list too.
Oh, yeah.
Why would that one need high concentration oxygen?
So with an upper airway burn, you know your airway could swell up, almost close off. That's super dangerous. High flow oxygen helps keep things open, pushes as much oxygen through as possible, even in that small space.
Makes sense, like forcing it through a bottleneck.
Yeah, exactly.
Okay, so we've got these cases where more oxygen is better, right?
All right.
But then there's COPD, which flips everything on its head.
Yeah. COPD is different.
So tell me what's going on there.
So with COPD, chronic obstructive pulmonary disease, it's a lung thing that makes it hard to breathe.
Right, yeah.
And in that case, the standard actually suggests a lower target saturation.
Lower.
Yeah.
Okay.
So between 88 and 92%.
That's interesting, because wouldn't someone who's having trouble breathing want more oxygen?
It seems like it, right, but it's more complicated. See, COPD changes how the body regulates breathing.
Okay.
Their body kind of gets used to high levels of carbon dioxide and actually uses that as the trigger to breathe.
Really?
Yeah. So if you give them too much oxygen, you actually mess with that signal.
Huh.
And it can be dangerous. Like the CO2 could build up in the blood even more.
So it's like this delicate balance between oxygen and carbon dioxide.
Yeah, exactly.
And the standard even talks about careful titration. What does that mean for the paramedics?
So basically, they're constantly monitoring the patient, watching how they respond,
Okay.
and they adjust that oxygen flow really precisely.
So they're not just turning it on and off. They're making these little tweaks to keep it right in that range.
Yeah, exactly. It's a lot of fine-tuning.
That's intense.
Yeah.
And the standard even says, be prepared to ventilate if someone's condition gets worse.
Right.
That's a pretty serious thing for paramedics to be thinking about.
Yeah, it shows you that this isn't just about oxygen. It's understanding how the whole respiratory system works together.
Okay, so we've talked about the standard guidelines, the exceptions.
Mm-hmm.
But what happens when technology fails? Like the standard even talks about situations where the pulse oximeter, the thing that measures oxygen,
Right.
what if that's not working right?
Yeah, then it's all about good old-fashioned observation. You have to look for things like cyanosis, that's like a bluish tint to the skin,
Okay,
and pay attention to the patient's breathing and how alert they are.
so even without the technology, they can still tell a lot.
Yeah. A good paramedic can gather so much info just by carefully observing.
Wow, so it's like they're taking this standard, but every patient's different.
For sure.
Every situation's different.
Yeah.
So how do they balance all of that?
That's what makes medicine so interesting, You have the knowledge, but then you need experience, intuition, and you have to adapt to what's happening.
Yeah.
And that's also why research is so important, because what we know today could change tomorrow.
That's a really good point. I think this deep dive has given me a whole new perspective on oxygen therapy.
Yeah, for sure.
It's definitely not as simple as I thought.
No, not at all.
A lot to think about.
Definitely.
Thanks for joining me.
No problem.
And thanks to all of you for listening. We will see you on the next deep dive.
Yeah.
All right, so you know how much we love a good crime drama, right?
Oh, yeah, definitely.
But have you ever stopped to think about what happens before the detectives show up?
Yeah.
Before they start dusting for fingerprints and all that.
Right before the yellow tape goes up.
Exactly.
Yeah.
That's where things get really interesting.
Oh, I bet.
Because more often than not, it's the paramedics who are first on the scene.
Makes sense. They're the ones responding to the 911 call, right?
Exactly. And today's deep dive is going to take us right into that world, the world of emergency medical response protocols.
Cool.
We've got excerpts from actual paramedic guidelines, and we're going to be focusing on how they navigate potential crime scenes.
Because those first responders, their actions can literally make or break a whole investigation.
Oh, absolutely. And, we always think of paramedics as these amazing lifesavers.
Right. Medical heroes.
Yeah, but they also play this crucial and often unexpected role in the justice system.
It's a fascinating side to their job that most people don't even realize.
Totally. And, one of the first things that jumped out at me from these guidelines is the emphasis on contacting the police in unusual or suspicious situations.
Okay, so not just any medical emergency, but when something seems off.
Right, and the examples they give are like straight out of a crime drama.
Ooh, like what?
Okay, so we're talking sudden deaths, obviously.
Yeah, that's a red flag for sure.
Right, but also violence, any signs of a struggle,
Okay, getting serious now.
and even accidents involving, emergency vehicles themselves.
Whoa, so they're not just patching people up. They're right there in the thick of potential crime scenes.
Exactly. And the protocol, it's not just a quick, hey, call the cops kind of thing.
Oh, there's got to be more to it.
Right, it's actually super detailed.
Yeah, what do they do?
Okay, so the guidelines lay out these specific steps, starting with contacting dispatch.
Of course, you got to get those wheels in motion.
Right, and they use these clear codes to indicate the urgency and the potential danger of the situation.
Ah, so it's like a secret language they use?
Kind of, like, in those cop shows, they're always yelling, secure the scene, secure the scene.
Yeah.
Well, these codes are like the real-life version.
Interesting.
So, for example, there's a code called 10200.
10200. Okay, what's that one?
That one signifies there's no immediate danger, so, the police can approach with caution.
Gotcha.
But then there's 102,000.
102,000. That sounds more intense.
Oh, yeah, that one signals a high-risk situation.
So like a potential active shooter or something?
Exactly, something where the police need to be ready for anything.
Wow. That really adds a whole other layer to their job.
Oh, totally. It's like they're balancing medical care with crime scene awareness all at the same time.
Talk about multitasking under pressure.
Right. But, okay, so they've called for backup, they've communicated the situation.
What happens when the paramedics actually get to the scene?
That's where the principle of scene preservation comes in.
Oh, yeah. You know, any Law and Order fan knows how crucial that is.
Exactly.
Yeah.
And paramedics are actually trained to minimize disturbance.
So every step they take is super calculated.
Oh, yeah. They have to handle everything with meticulous care because even a seemingly simple act,
Like what?
like even just shifting a body slightly, could compromise valuable evidence.
No way, really?
Yeah, it's like they become extensions of the forensic team.
Wow, that's a huge responsibility.
It is. And get this, the guidelines even talk about the importance of preserving their own clothing.
What, their uniforms?
Yep. And any linens they use on the scene.
Because those could have trace evidence on them.
Exactly. Like imagine a tiny fiber from a paramedic's uniform ends up being the key clue that solves the whole case.
Okay, that's mind-blowing.
It's like every action, every step they take becomes part of this giant chain of evidence.
It all connects back.
It all connects back. But okay, this is where I started wondering.
Yeah.
Aren't there situations where saving a life kind of takes precedence over preserving every tiny little detail?
Right, like what if someone needs immediate care and moving them is unavoidable?
Exactly. And the guidelines do acknowledge that their primary duty is always to the patient.
Of course, saving lives comes first.
Right. But they also stress minimizing disturbance whenever possible.
So it's a delicate balance?
It really is. Like they have to think like detectives while also being these incredible lifesavers.
Yeah, that takes serious skill.
Oh, for sure. And speaking of detective work, you know what really caught my eye in the guidelines?
What's that?
The section on hangings.
Hangings. Okay, that's getting dark.
I know, right?
Ooh.
But it totally piqued my curiosity because apparently hangings present these unique challenges.
Oh, how so?
Well, for one thing, the guidelines specifically instruct paramedics to carefully observe the position of the rope
Okay.
and the type of knot used.
Really, those little details matter that much?
Oh, yeah, because those elements can actually help investigators determine whether it's a suicide, an accident, or even foul play.
Whoa, so even the way a rope is tied can be a clue.
Exactly. It's
Yeah.
all about the details. But here's another thing I was thinking. Wouldn't emergency care in a hanging often involve, like, cutting the rope?
Right, to get the person down.
Exactly. But doesn't that risk destroying crucial evidence?
Oh, good point.
And the guidelines address that too.
They do.
Yeah, they say that cutting the rope should always be a last resort.
Okay, so if at all possible, try to preserve it intact.
Right, and even if they absolutely have to cut it, the knot itself must be preserved.
Really, they have to save the knots.
Yeah, it's like a tiny piece of the puzzle.
Wow, that's intense.
Yeah, it is. Right, it's this perfect example of the tension between providing urgent care and protecting the integrity of a potential crime scene.
It's incredible how much paramedics have to think about in those high-pressure situations.
Right, like their training goes so far beyond just the medical stuff.
They're practically investigators, too.
Totally.
Yeah.
So we've talked a lot about the how of these protocols.
Yeah, the specific steps they take.
Right, but now I'm curious about the why.
The bigger picture.
Exactly. What are the implications if these guidelines aren't followed correctly?
Oh, well, the potential consequences are huge.
Yeah.
Mishandling evidence could lead to a wrongful conviction
Oh,
or even allow a guilty person to go free.
that's a scary thought.
It is, and it really highlights how important these protocols are.
Right, because they're not just bureaucratic hoops to jump through.
Exactly. They're there for a reason.
Yeah. They're safeguards for justice. They ensure that investigations are conducted fairly and accurately.
And that everyone's rights are protected.
Exactly. So next time we're all caught up in some thrilling crime drama,
Yeah.
maybe we should take a moment to appreciate those real-life paramedics who are often laying the groundwork for those investigations.
The unsung heroes of the justice system.
Totally, because their meticulous work often goes unseen, but it's such an integral part of ensuring that the truth has a fighting chance.
Couldn't have said it better myself.
It really makes you think, though.
It does.
Like, imagine you're a paramedic. You're first on the scene.
Okay.
You see a victim who needs immediate help.
Right. Every second counts.
But then you also notice something out of place.
Like what?
I don't know, a broken window, a misplaced object, anything that just doesn't seem right.
Ah, so now you're thinking crime scene.
Exactly.
Mm-hmm.
And in that moment, you have to balance the urgency of providing medical care
Right.
with the need to preserve potential evidence.
Wow, that's got to be a tough call.
It is. And that's the kind of challenging scenario that these protocols help paramedics navigate every single day.
It's amazing the weight they carry on their shoulders.
It really is.
Makes you appreciate their work even more.
Definitely.
Welcome back, everyone, to The Deep Dive, where we, well, take a deep dive into a new topic every week.
That's right.
And today,
Yeah.
we are going to be cracking open the patient assessment standard
All right.
used by paramedics to get a glimpse into their world.
Sounds good.
You might be thinking, what's in it for me? I'm not a medical professional,
Yeah.
but trust me,
Right.
understanding how paramedics approach a situation
Yeah.
with a blend of caution and quick thinking can be incredibly useful for anyone, especially in those unexpected situations.
That's true.
When something happens and you're not sure what to do.
Right.
So,
It can be very helpful.
yeah, so let's dive right in.
Right.
One thing that jumped out at me was this idea of always assuming the worst case scenario.
Yeah,
Is that a bit, well,
that's a fundamental principle of
I mean, wouldn't that lead to unnecessary interventions or even panic?
It might seem counterintuitive,
Yeah.
but there's a really good reason for that approach. By assuming a serious, potentially life-threatening condition from the start,
Mm-hmm.
paramedics eliminate hesitation and ensure that they're prepared for any eventuality.
So it's like flipping a switch in their minds,
Yeah.
instantly putting them in high gear.
Exactly.
But how do they balance that with staying calm and not freaking out the patient?
Well, it's a delicate balance, for sure.
Yeah.
While they're mentally preparing for the worst, they also need to project calm and reassurance to the patient.
Right.
It's about being prepared for anything while also maintaining a reassuring presence for the patient.
That makes sense.
Yeah.
It's like that old saying, hope for the best, but prepare for the worst.
Right.
So once a paramedic arrives on the scene, what happens next?
Before they even lay a hand on the patient,
Okay.
they're already gathering vital information by simply observing the scene.
So it's more than just rushing in to treat the patient.
Absolutely.
Okay.
Think of it like a detective arriving at a crime scene. They're scanning the environment for clues, medication bottles, potential hazards, signs of a struggle,
Wow.
anything that can provide insight into the patient's condition.
I never realized how much information could be gleaned from just looking around.
It's amazing what seemingly insignificant details can reveal.
Right.
For example, imagine a scenario where a patient is found unconscious
Yeah.
near an overturned ladder.
Okay.
That simple observation instantly suggests a possible fall and potential head or spinal injuries.
Oh, wow.
Yeah.
So paramedics are essentially putting together a puzzle, using every piece of information to form a clearer picture of the situation.
Exactly.
Oh, okay.
And that brings us to the next crucial step, the primary survey.
Right.
This is where the ABCs,
Yes.
airway, breathing, and circulation
I know.
take center stage.
I know the ABCs are important,
Right.
but I never really understood why they're prioritized in that specific order.
Well, imagine a chain where each link represents a vital function.
Okay.
If one link breaks, the entire chain fails.
Yeah.
Airway comes first, because without a clear airway, oxygen can't reach the lungs and nothing else matters.
That makes sense.
Breathing follows because, well, you need to breathe to survive.
Right.
But what about circulation? Why is that so critical?
Yeah.
Circulation is all about getting oxygenated blood to the rest of the body,
Okay.
including vital organs like the brain.
Mm-hmm.
If circulation is compromised, even if the airway and breathing are fine, the body will shut down.
So it's like a domino effect.
Right.
Each element is dependent on the one before it.
Yeah, actually.
So by addressing the ABCs in that order, paramedics are essentially ensuring that the foundational elements of life are intact.
Precisely.
Yeah.
And they're doing this rapidly, searching for any life-threatening conditions like major bleeding or airway obstruction.
Right, so speed is of the essence.
Yes.
But I'm guessing they're also looking for other clues about the patient's condition, right?
Absolutely. That's where vital signs come in. Things like heart rate, blood pressure, and respiratory rate can provide valuable insights into what's going on inside the body.
Okay, we've all had our vital signs checked at the doctor's office,
Yeah.
but what are paramedics specifically looking for in those numbers?
Each vital sign tells a story.
Okay.
For example, a rapid heart rate could indicate shock, while low blood pressure might suggest internal bleeding.
Mm-hmm.
But it's not just about the individual numbers. It's about how they relate to each other and how they change over time.
So they're not just getting a snapshot.
Right.
They're looking for trends and patterns
Exactly.
that can help them make informed decisions.
And that's where the concept of baseline measurements comes in.
Baseline measurements, what are those?
Think of it as a reference point.
Okay.
By taking those initial measurements,
Mm-hmm.
paramedics can track how the patient's vital signs change in response to treatment or if their condition deteriorates.
So it's like a benchmark to see if things are improving or getting worse.
You got it. And this constant vigilance is crucial because, as we've learned, a patient's condition can change rapidly.
Right.
Now let's talk about a specific tool that helps paramedics assess a patient's neurological status.
Okay.
the Glasgow Coma Scale, or GCS.
I've heard of the GCS, but I'm not entirely sure what it entails.
Sure,
Can you break it down for us?
of course.
Thanks.
The GCS is a standardized way to assess a patient's level of consciousness.
Okay.
It looks at 3 key areas: eye-opening, verbal response, and motor response.
So they're checking how the patient responds to different stimuli.
Exactly.
Mhm.
Each response is given a numerical score,
Mm-hmm.
and those scores are added up to give an overall GCS score.
And a lower score means?
A lower score indicates a decreased level of consciousness, which could suggest a brain injury or other neurological issue.
Right.
But it's important to remember that the GCS score is just one piece of the puzzle.
So it's not a definitive diagnosis, but rather a tool that helps paramedics get a better understanding of the patient's neurological function.
Precisely. It helps guide their treatment decisions and provides a baseline to monitor for any changes in the patient's neurological status.
Okay, I'm starting to get a feel for how all these pieces fit together.
Good.
Scene observation, the ABCs, vital signs, and the GCS. It's
Yeah.
like they're building a case file, gathering evidence to solve the mystery of what's going on with the patient.
That's a great analogy.
And just like a good detective, paramedics are trained to look for those subtle clues that might point to a hidden injury or underlying condition.
Exactly.
So it's not just about treating the obvious, it's about digging deeper and looking for those less apparent issues.
Exactly. It's about seeing the whole picture, not just the surface details.
This is all incredibly fascinating.
Yeah. It-
Seriously, I'm getting a glimpse into the world of paramedicine through a whole new lens.
It's a world that demands a unique blend of knowledge, skill, and compassion.
And speaking of compassion, one thing that struck me was this idea of medical information tags.
Oh yeah, those are really important.
It seems like such a simple thing,
Yeah,
but it can make a world of difference in an emergency.
you're absolutely right. Those bracelets or necklaces can be lifesavers,
Right.
especially if a patient is unconscious or unable to communicate.
Yeah?
They can alert paramedics to allergies, medical conditions, or medications that could impact treatment decisions.
So it's like giving a voice to those who might not be able to speak for themselves.
Exactly.
Yeah.
It's a small detail that can have a huge impact on patient care.
This has been an incredible journey so far, and I'm eager to dive even deeper into the world of paramedicine.
Okay.
But before we continue, let's take a moment to gather our thoughts and prepare for the final stretch of our deep dive.
Sounds good. It's amazing how such a small thing can make such a big difference.
Right.
Like a piece of jewelry can really be a lifesaver in an emergency situation.
It's true.
Yeah.
They say the devil is in the details.
Mm-hmm.
But speaking of details,
Yeah.
let's move on to something that's always intrigued me. Cardiac monitoring.
Okay.
Is it really necessary in every situation?
Well, that's a good question.
It always seems like something you'd only see in like a dramatic medical TV show.
Yeah, not every patient needs their heart rhythm displayed on a monitor,
Okay.
but there are certain scenarios where it becomes absolutely crucial.
Okay. I'm all ears.
Right.
Give me the insider scoop
Right.
on when those heart monitors come into play.
So think of it this way.
Mm.
The heart is the engine of the body.
Okay.
And if the engine sputters or fails, everything else is affected.
Right.
So in situations where the heart's function is a major concern,
Right.
cardiac monitoring is essential.
So if someone's unconscious
Yes.
or experiencing chest pain,
Mhm.
it's a no-brainer to hook them up to a monitor.
Exactly.
Okay.
Unconsciousness, suspected heart attack,
Mm-hmm.
severe shortness of breath.
Mm-hmm.
These are all situations where paramedics want to keep a close eye on the heart's activity.
So it's like having a window into the heart's control center,
Yeah.
allowing paramedics to see exactly what's going on. But what kind of information are they getting from those squiggly lines on the monitor?
Well, those squiggly lines tell a detailed story about the heart's rhythm and electrical activity.
Okay.
They can reveal abnormalities like irregular heartbeats, which can be life-threatening if not addressed quickly.
So the monitor helps paramedics identify problems
Yes.
and make those split-second decisions about treatment.
Exactly.
But what about those less obvious situations?
Yeah.
Are there times when cardiac monitoring might be needed even if the patient seems relatively stable?
Absolutely.
Okay.
Let's say someone has experienced a significant trauma like a car accident.
Mm-hmm.
Even if they don't have obvious chest pain,
Right.
there could be internal injuries affecting the heart.
Okay.
In those cases, cardiac monitoring can provide early warning signs of potential complications.
Wow. So it's not just about reacting to what's immediately apparent.
Right.
It's about anticipating potential problems that might not be obvious at first glance.
Exactly. It's about being proactive and staying one step ahead.
So we've covered scene observation, the ABCs,
Hmm.
vital signs,
Yeah.
and cardiac monitoring.
Right.
It's like a step-by-step process,
Hmm.
building a comprehensive understanding of the patient's condition.
Yeah.
But is that the end of the assessment?
Well,
Or is there more to the story?
there's always more to uncover.
Okay.
Once those initial life-saving measures are addressed,
Okay.
paramedics move on to the secondary survey,
Right.
a more thorough head-to-toe assessment.
Okay, so if the primary survey is like a quick scan,
Yes,
the secondary survey is the in-depth analysis.
that's a great way to put it.
Right.
It's during this stage that they'll look for less obvious injuries or underlying medical conditions
Okay.
that might not have been apparent during the initial assessment.
So what kind of things are they looking for during this secondary survey?
All right.
Give us the details.
Imagine a patient who was in a car accident.
Okay.
During the primary survey,
Mm-hmm.
paramedics might have focused on stabilizing their neck and spine,
Okay.
controlling any bleeding,
Right.
and ensuring they're breathing properly.
Mm-hmm.
In the secondary survey,
Okay.
they'll meticulously examine the patient's entire body,
Okay.
carefully palpating
Okay.
or feeling
Yeah.
for any tenderness, deformities, or other signs of injury.
So they're essentially looking for those hidden injuries that might not have been immediately apparent.
Exactly. It's about leaving no stone unturned.
Right.
For example, they might discover a fractured rib that wasn't obvious at first,
Oh, wow.
or subtle neurological deficits that suggest a spinal cord injury.
It sounds incredibly thorough.
It is.
But with all this information coming in,
Yeah.
how do paramedics keep track of everything?
Well,
It seems like a lot to juggle, especially in a high-pressure situation.
that's where their training and experience come in.
Right.
They're not just memorizing a checklist. They're developing a deep understanding of anatomy, physiology,
Mm-hmm.
and pathophysiology,
Okay.
the study of how diseases affect the body.
So they're able to connect the dots and make sense of all the information they're gathering.
Exactly. They're constantly analyzing, interpreting, and integrating all those pieces of information
Right.
to form a clear picture of what's going on with the patient.
Okay.
But it's not just about gathering data, it's also about communicating effectively.
Communication.
Yeah.
What role does that play in the assessment process?
Communication is absolutely essential in paramedicine.
Okay.
They need to clearly communicate their findings to other healthcare professionals, both at the scene and at the hospital.
Right.
This ensures that everyone involved in the patient's care is on the same page.
So it's not just about doing the assessment. It's
Yeah.
about conveying that information accurately and efficiently.
Precisely.
Okay.
And it goes beyond just medical jargon.
Right.
They also need to be skilled communicators when interacting with patients.
Okay. What do you mean?
Imagine being in a car accident. You're scared, you're in pain, and probably a bit confused. Having a paramedic who can calmly explain what they're doing,
Right.
why they're doing it,
Yeah.
and what to expect can make a huge difference in your experience.
So it's not just about treating the physical injuries. It's
Yeah.
about addressing the emotional and psychological needs of the patient as well.
Exactly. It's about providing holistic care,
Mm-hmm.
treating the whole person, not just the symptoms.
This is all so fascinating.
It is.
It's like peeling back the layers of an onion, revealing the complexity and nuance of paramedic assessment.
It really is.
It's more than just checking boxes and following protocols.
Right.
It's about critical thinking,
Mhm.
problem solving,
Yeah.
and human connection.
You hit the nail on the head. It's about using all their skills and knowledge to provide the best possible care in every situation.
This deep dive has been an incredible journey so far.
Really
We've
cool.
learned so much about the systematic approach paramedics use,
Mm-hmm.
but I'm curious to explore the other side of the coin. Their ability to adapt and think on their feet. But before we get into that, let's take a quick pause to gather our thoughts and prepare for the final stretch of our exploration.
Sounds good.
Okay, so we're back,
All right.
ready to wrap up our deep dive into the world of paramedic assessment.
Yep.
We've uncovered a lot about their systematic approach,
Yeah.
but I'm also curious about how they handle those unpredictable moments when
Wow.
things don't go according to plan.
That's where the art of adaptability comes in.
Right.
Paramedics are trained to not only follow protocols, but to think on their feet
Okay.
and adjust their approach as the situation demands.
So it's not just about sticking to a rigid checklist.
No.
It's about being able to improvise
Yeah.
and make decisions in the heat of the moment.
Exact. Remember how we talked about the importance of constant reassessment?
Yeah.
That principle really shines when a patient's condition changes unexpectedly or after an intervention.
Okay, so they're constantly evaluating,
Yes.
analyzing, and tweaking their strategy to make sure the patient is getting the best possible care.
Precisely.
Okay.
Let's say a paramedic has administered medication to help stabilize a patient's blood pressure.
Okay.
They're not just going to assume everything is fine.
Right.
They'll be closely monitoring the patient,
Okay.
looking for any indication that the medication is working as intended or if further intervention is needed.
So it's like they're playing a game of medical chess,
Uh-huh.
always thinking several moves ahead and anticipating potential complications.
That's a great analogy.
Yeah,
They're not just reacting to what's happening right now.
right.
They're proactively planning for what might happen next.
Okay.
And that ability to adapt is crucial because, as we've seen, a patient's condition can change in an instant.
So it's a constant dance between following protocols and adapting to the ever-changing situation.
Right.
But how do they know when to deviate from those standard procedures?
Yeah.
What guides those decisions?
It's a combination of experience, critical thinking, and intuition.
Okay.
Over time, paramedics develop a keen sense for recognizing those subtle cues
Mm-hmm.
that might signal a need to change course.
Okay.
It's about trusting their instincts and being willing to make those tough calls.
That must be incredibly challenging,
It can be.
especially when dealing with life or death situations.
Yeah.
It's like walking a tightrope between following the rules and knowing when to break them.
Exactly. And that's what makes paramedicine so demanding yet so rewarding.
Right.
It's about using your head, your heart, and your gut to make the best possible decisions for your patient.
Wow. I'm really starting to grasp the complexity of their role.
Yeah.
It's not just about knowing the procedures.
Right.
It's about understanding the nuances of each situation and being able to adapt on the fly.
And that adaptability isn't just limited to the medical field.
Oh, right. Yeah,
Think about how often we encounter unexpected challenges or roadblocks in our own lives.
that's true. Whether we're facing a work deadline or navigating a personal crisis or just
Mhm.
trying to make it through a chaotic day. That ability to adapt and reevaluate is essential for success.
It's about embracing flexibility,
Right.
being open to new information, and never being afraid to adjust our course when necessary.
Okay.
And that's a valuable lesson we can take away from the world of paramedicine.
This deep dive has been absolutely eye-opening.
Good.
I feel like I've gained a whole new level of respect for the work that paramedics do.
It's an amazing profession.
It's more than just a job. It's a calling
Right.
that demands both technical expertise and a deep well of compassion.
I completely agree.
Well, it's been great having you on today.
Oh, thanks for having me.
Really appreciate all your insights.
You're welcome.
And for all of you listening out there,
Yeah.
we hope you learned something new today about the world of paramedicine
Mhm.
and how we can all apply those same principles to our own lives.
Right.
Until next time, stay curious, stay informed, and stay safe.
Great advice. We all know paramedics are the ones we call when there's a medical emergency.
Yeah.
But have you ever thought about, like, what rules they actually follow, you
Mm.
know? The guidelines they have to stick to.
Yeah, absolutely.
So today,
It's a whole world unto itself.
we're doing a deep dive into the world of paramedic standards, specifically in Ontario, Canada.
Okay.
Now, you might be thinking, all right, Paramedics Ontario.
Right.
Why does this matter to me?
Yeah.
But stick with us, because these guidelines, they go way beyond just like the medical procedures you might think of.
Mm-hmm.
It's actually a really fascinating look into how paramedics have to balance their, incredible life-saving skills with making really ethical decisions on like every single call.
It's true. And these standards are surprisingly detailed.
Yeah.
They really outline a whole ethical and professional framework for, the entire field of paramedicine.
Totally. And you were kind enough to share some official documents with me.
Right.
And I got to say, I was kind of blown away by just how in-depth these things are.
Yeah.
So let's start with something called the Paramedic Conduct Standard.
Okay.
This covers way more than I initially thought it would.
Well, this standard really highlights how holistic the whole approach to paramedicine is.
Okay.
It's not just about, getting to a scene and stabilizing someone.
Right.
It's about making sure that you're promoting their health
Okay.
and maintaining their dignity throughout the entire process.
So what does that actually look like,
Mm,
in the field?
Yeah.
What's an example of it?
okay, well, imagine a situation where someone's been in like a really serious car accident.
Okay.
They're injured, they're scared, they're surrounded by strangers,
Right.
total chaos.
Yeah.
In that moment, a paramedic who's prioritizing that person's dignity might take the time to explain what they're doing before they even touch them.
Okay.
Use a really calming voice or even try to shield them from onlookers or something like that.
So it's about treating the person, not
Yeah.
just the injury.
Exactly. And it's not just about, the immediate situation either.
Mm-hmm.
This standard also talks about like how important continuous learning is. Emergency medicine is always evolving.
Oh, for sure.
And paramedics are expected to stay totally up to date on the latest knowledge and techniques.
Right, because what might have been best practice 5 years ago might be totally different now.
Exactly.
Now, there's also a section, and I found this really interesting, on paramedic misconduct,
Right.
which is, pretty clear-cut about what you absolutely cannot do.
Yeah.
Things like practicing beyond what you're certified for, refusing to help somebody who needs help,
Right.
or like falsifying records, stuff like that.
Yeah.
Those are serious no-nos.
Yeah.
But why?
Well, I think it's pretty clear, right? These rules are there to protect everybody involved.
Okay.
And obviously, patient safety is like the top priority.
Makes sense.
A paramedic who's operating outside of their training
Right.
could make a mistake, like a really dangerous mistake.
Absolutely.
Yeah.
So patient safety is a big one. What are some of the other reasons?
Well, think about it. These standards also, they uphold the public's trust in the profession as a whole,
Okay. Yeah.
right? People need to know that paramedics are held to, the highest possible standard.
Yeah, absolutely.
And, finally, it's about accountability within the profession itself.
Yeah.
There are serious consequences if you engage in misconduct.
Yeah.
Potentially including, losing your license to practice.
Wow. So there's a real emphasis on responsibility and professionalism.
100%. And, to maybe give you a little bit more of a concrete understanding of how these standards actually play out in real life.
Okay.
I can tell you about a case that actually had a pretty big impact on how these guidelines were developed.
Okay.
So a few years ago, there was a case where a paramedic didn't assess a patient's airway properly,
Okay.
and it led to a really tragic outcome.
Nope.
And the investigation after that found that the paramedic hadn't kept up with their required certifications and was operating outside of, what they were actually allowed to do.
So that's a very real example of what can happen
Exactly.
when those standards aren't followed.
And it served as a really stark reminder of how important it is to,
Yeah.
adhere to these standards and what can happen if you don't.
Yeah.
Yeah.
That's a sobering reminder for sure
Yeah.
of the weight that paramedics carry.
Mm-hmm.
Okay. Now, shifting gears a bit. The section on confidential information,
Right.
that really stood out to me. It's incredibly detailed, which tells me this is a really big deal.
You're right. This is all about maintaining that trust that is so important in the patient-paramedic relationship,
Yeah.
And the standards specifically lay out 3 types of confidential information
Okay.
that paramedics have to protect.
Can you break those down for us?
Yeah.
What are those 3 types?
Yeah, for sure. So the first one is just basic identifying information,
Right.
like someone's name, address, date of birth.
Okay, so pretty straightforward stuff.
Pretty straightforward. Then there's personal health information, which includes things like, medical history, current medications, diagnoses, that kind of stuff. So obviously, this is super sensitive.
Yeah,
Releasing that without consent could have really serious consequences for somebody.
absolutely. And then the third type.
So the third type is any information that a paramedic gets specifically because of their role during the call.
Okay.
That wouldn't be public knowledge otherwise.
Okay.
So this could be stuff like details about the patient's condition at the scene, the circumstances surrounding how the emergency happened,
Right.
or even conversations that they overhear.
So basically anything that could either identify the patient
Exactly.
or reveal something about their health or the situation that's sensitive is totally confidential.
Exactly. And the standards go even further because they actually give guidance to paramedics who might not be sure
Oh, interesting.
about if they can disclose something or not.
Okay.
They're told to basically err on the side of caution.
Okay.
And if they have any doubt at all, to contact their Central Ambulance Communications Center,
Right.
or CACC for short.
So there's a built-in support system to help them if they're not sure.
Exactly.
Okay, that's good to know.
Yeah, it really emphasizes how seriously they take this whole, confidential information thing.
It makes you feel more confident knowing that, if there's something happens,
Right.
your information is not just going to be, flying around.
Yeah, definitely adds another layer of trust and professionalism to the whole thing.
Absolutely.
Yeah.
All right. So we've talked about how paramedics are supposed to conduct themselves.
Right.
We talked about confidentiality.
Yeah.
Now let's move on to something that I think is really cool because it kind of gives you a behind-the-scenes look at their process. And that's the General Measures Standard.
Okay.
And this section basically outlines the specific steps that paramedics have to take on every single call.
It's a fascinating look at the methodical approach that underlies every single emergency response.
Yeah, totally.
And, it might seem simple on the surface,
Right.
but every one of these steps has a purpose. It's about efficiency and it's about safety.
So let's walk through some of those steps. What I'm curious about is, the why behind each one.
Okay, yeah.
What's the thought process that a paramedic is going through with each action?
Yeah, well, take, for example, the very first step.
Okay.
Confirming the call information.
Right.
With the CACC. This isn't just like a box to check off.
Okay.
This is about making absolutely sure they're going to the right place.
Right.
And that they have a clear understanding of what they're walking into.
Yeah, because if you go to the wrong place or you think it's, a broken leg and it's a heart attack.
Exactly,
Yeah.
that problem.
You're wasting time. Yeah. What about when they get to the scene, the next step is assessing the environment.
Right.
What's the importance of that?
That's all about safety for everybody,
Okay.
including the paramedics themselves.
All
So
right.
before they even approach the patient,
Okay.
they're trained to scan the entire scene, look for any potential hazards,
Okay.
and even plan escape routes
Wow. Okay.
if they need to.
So it's not just about rushing in.
No,
It's about taking a moment to strategize and be sure that everybody's safe.
exactly. A paramedic who takes the time to really assess the scene, they're not being cautious. They're being smart.
Right.
They're protecting themselves and everybody else involved. And this could mean, anything from spotting a downed power line to noticing signs that, there might be some violence at the scene, something like that.
So they're really taking in the whole picture.
Exactly.
Not just focusing on the patient, but thinking about everything around them as well.
Right. And, there was actually a case a few years ago where a paramedic's really thorough assessment of a car accident scene
Okay.
saved lives.
Really?
Yeah, they noticed a leaking gas canister that everybody else had missed.
Oh, wow.
And they were able to, evacuate everybody from the area before there was a potential explosion.
Wow. That's a powerful example of how those initial moments
It can make all the difference.
can be so crucial.
Yeah, it really highlights how important it is to think beyond, just the medical needs of the moment
Mhm.
and really take in the whole picture. Think big picture.
Okay. So now, the General Measures Standard also mentions that paramedics have to bring specific equipment to the point of initial patient contact.
Right.
Why is that?
That's all about being prepared to act immediately,
Uh-huh.
even before they've had a chance to, fully assess the patient.
Okay.
So they're always going to bring the equipment that they need to establish baseline vital signs
Okay.
and to perform defibrillation if that becomes necessary.
So they're ready to go in those first few moments.
And as they gather more information at the scene,
Okay.
they're constantly evaluating, what else they might need.
Okay, so they're thinking ahead.
Exactly.
Yeah.
And the standards emphasize how important it is to communicate those needs to the CACC as early as possible.
Oh, okay. So again, it's about thinking ahead.
Yeah, and making sure they have all the right resources available.
So it's not just about what they bring initially.
No, it's a dynamic process.
It's about communicating with the team.
And that communication with the CACC, it's ongoing.
Okay.
It's not just a one-time check-in.
So why is it continuous like that? What's the purpose of that?
Well, it allows the CACC to track the situation, in real time.
Okay.
To send more resources if they're needed,
Okay.
and to coordinate with other emergency services.
So like police, fire.
Exactly. It's
Okay.
like a lifeline that's
Yeah.
connecting the paramedics on scene
Yeah.
to a much larger system of support.
So even though they might be the only ones physically there,
Yeah.
they're still part of this team.
That's a great way to put it. And all of these actions, from assessing the scene to deciding what equipment they need
Right.
to communicating with the CACC, it's all driven by that underlying commitment to
Yeah.
safety, both their own safety and the patient's safety.
Speaking of safety, the standards are really big on personal protective equipment.
Of course.
PPE,
Yeah.
which might seem obvious,
Yeah.
but I can imagine in the heat of the moment,
Right.
it's easy to kind of forget
Yeah.
or downplay, like, oh, I don't need gloves for this.
It's human nature to want to jump right in and help,
Totally.
But these standards are very clear about following very specific procedures for using
Right.
and disposing of PPE.
So what's the reasoning behind all that?
Well, I mean, you have to remember that paramedics are exposed to all sorts of things,
Yeah.
biohazards,
Yeah.
infectious diseases,
Sure.
other risks. By taking those precautions, they're protecting themselves, their patients, and the whole community.
It's kind of like they say you can't pour from an empty cup, right?
Exactly.
If you don't take care of yourself, you can't take care of other people.
Exactly. And that focus on safety goes beyond just PPE.
Okay.
The standards also highlight how important it is to use equipment safely
Okay.
and to dispose of it properly, especially when it comes to things like sharps.
Right, because a stray needle could be a problem
Exactly.
for anybody at the scene.
Exactly.
What other things in this section kind of jumped out at you?
You know what I thought was interesting? And it's often overlooked, but they have to identify themselves and introduce themselves to the patient
Okay.
and anybody else who's there.
So it's about making that human connection.
Exactly. It's acknowledging that the patient is an individual,
Right.
even in the middle of a crisis.
Yeah, not just a case number.
Exactly. And it just kind of sets the tone
Yeah.
for respectful, patient-centered care.
And then, obviously, there's the whole issue of consent. The General Measures Standard specifically mentions obtaining consent for any care.
Right.
And they reference the Ontario Healthcare Consent Act of 1996.
Mm-hmm. That's a crucial legal and ethical piece of the puzzle.
Okay.
So before they provide any kind of treatment,
Okay.
paramedics have to get informed consent
Okay.
from the patient or their substitute decision maker if, the patient can't consent for themselves.
Which makes sense, in most situations.
Right.
But what about when it's an emergency?
Yeah.
Like, what if the person is unconscious or they can't communicate clearly?
That's when it gets a lot trickier.
Yeah.
And that's where paramedics really have to rely on their training and their judgment to
Okay.
determine what's in the patient's best interest,
Okay.
even if they can't, get that explicit consent.
So how do they approach those situations?
Well, whenever they can,
Yeah.
they'll try to involve family members
Okay.
or caregivers who might, be able to shed some light
Yeah.
on what the patient would want
Okay.
or how they typically make decisions. But at the end of the day, their main duty is to act in the patient's best interest,
Okay.
even if that means making a really tough call
Yeah.
without that clear consent.
It sounds like those situations require
Sorry.
a ton of sensitivity.
Yeah, it's a real ethical challenge.
Absolutely. And I think these scenarios really show
Yeah.
that paramedics aren't just dealing with, physical injuries.
No.
They're dealing with all these complex social and ethical things too.
Yeah, it takes a lot of compassion
Absolutely.
and critical thinking
Mm.
and a real commitment to, advocating for their patients.
All right. So we've talked about PPE,
Right.
introductions, consent.
Mm-hmm.
What else does this general measures standard kind of cover?
Well, it also talks about the importance of using proper communication techniques
Okay.
to build trust with the patient.
So it's not just about being polite.
It's more than that. It's about really listening to the patient,
Okay.
showing empathy. Yeah.
And explaining things in a way that they can understand.
Right.
Especially when they're, in a really stressful situation.
Right. Because medical jargon can be pretty confusing
Exactly.
if you're not in the field.
And when you're already stressed and scared,
Exactly.
the last thing you need is somebody talking over your head.
Yeah. So it seems like clear, compassionate communication
It makes a huge difference.
can really affect how a patient experiences that interaction.
Absolutely. It can help to calm them down,
Agreed.
reduce their anxiety,
Okay.
and even make them more likely to cooperate with the treatment.
Okay, that makes sense. The standard also mentions protecting the patient from hazards and adverse environmental conditions.
Right.
What does that look like practically?
Well, it could be anything from moving the patient to a safer spot
Okay.
to shielding them from, rain or snow,
Right.
or even just, providing basic comfort measures
Okay.
like blankets or pain relief.
So going beyond just the purely medical stuff. Yeah, exactly. It's about recognizing that even those small actions
Yeah.
can make a big difference to
That's
how
what
a
I-
patient feels.
It's really impressive, you
Yeah.
know, how much thought
Yeah,
and care goes into this whole process.
it really is.
Are there any other things in this section that you think our listeners should know about?
Let's see. Well, there's a point about referencing the Transport Canada Emergency Response Guidebook
Okay.
for scenes that involve hazardous materials.
Oh, interesting. So they need to be prepared for more than just like a heart attack or a car accident.
Oh, yeah, for sure. Paramedics are often the first ones to get to a scene,
Right. Right.
and they need to be able to quickly assess and manage a whole range of situations,
Right.
including those that involve dangerous materials.
Yeah.
And that guidebook basically gives them all the information they need
Okay.
to identify those materials, to understand what the risks are,
Right.
and to take the right precautions to keep everybody safe.
So it's another reminder of like how diverse the challenges are
Mhm.
that they face and the amount of knowledge
Yeah, they got to know a lot.
they have to have.
For sure.
And then finally, the
Yeah.
standard ends with a very simple but crucial instruction.
What's that?
Perform hand hygiene.
Ah.
Again, it might seem super obvious,
Right.
but why is it in there?
Because it's one of the most effective ways
Okay.
to stop the spread of infection.
Okay.
Paramedics are constantly interacting with patients,
Right.
often in environments that aren't exactly sterile, so
Yeah.
washing their hands is super important.
Makes sense. It's a reminder that even those little things, if you do them consistently, can have a huge impact.
It really speaks to that level of professionalism
Yeah.
and commitment that's behind everything paramedics do.
Absolutely.
They're not just treating one person, they're contributing to the well-being of the whole community.
It's inspiring to see, how much dedication goes into this. So we've talked about the ethical framework they work within, the specific steps they take on every call,
Right.
their commitment to safety
Yeah.
and patient care. It's amazing how much we can learn
I know, right.
from these standards.
It's really interesting stuff.
And we've only just scratched the surface. We'll be back in a moment to wrap up our deep dive
Okay.
into the world of paramedic standards.
Sounds good.
Stay tuned.
It really is amazing the level of detail they go into
Yeah.
to make sure that every aspect of the scene is considered
Right.
and that everybody is safe.
Totally.
It's not just about treating the patient, it's
Right.
about being aware of the whole environment.
Now, the General Measures Standard also mentions that paramedics have to bring specific equipment
Okay.
to that initial point of patient contact.
Right.
What's the thinking behind that?
That's all about being ready to act right away.
Oh.
Even before they've had a chance to fully assess the patient.
Okay. So they're always going to bring the stuff they need to get those baseline vitals
Okay.
and to do defibrillation if they need to.
So it's about having those essential tools right there.
Exactly.
In those first critical moments.
And as they get more information at the scene,
Right.
they're constantly evaluating and thinking about what other equipment they might need.
Right.
And the standards really emphasize how important it is
Okay.
to communicate those needs to the CACC as soon as possible.
So it's about thinking ahead
Exactly.
and making sure they have the right resources on hand.
And that communication with the CACC,
Yeah.
it doesn't stop there.
Okay.
It's ongoing.
Okay, so why is it continuous like that?
Well, it lets the CACC track what's happening in real time
Okay.
so they can send extra help if it's needed
Okay.
and coordinate with the other emergency services.
Right. So police, fire, whoever.
Exactly.
Okay.
Basically a lifeline
Yeah.
that's connecting the paramedics on scene
Okay.
to a whole network of support. So even though they're the only ones physically there,
Right.
they're still part of a larger team.
That's a great way to put it.
And all of these things, from assessing the scene to deciding what equipment they need,
Right.
to that constant communication,
Right.
it's all about safety
Absolutely.
for everyone involved.
There's safety and the patient's safety.
Speaking of safety, the standards also put a lot of emphasis on PPE,
Of course.
personal protective equipment,
Right.
which might seem obvious,
Yeah.
but in the heat of the moment,
I can see how it would be easy to forget.
or to downplay it, right?
Yeah.
Be like, I don't need gloves for this.
I'm good.
Yeah, exactly.
It's human nature to just want to help,
Totally.
But the standards are really strict
Okay.
about paramedics following the proper procedures
Okay.
for using and disposing of PPE.
Why is that so important?
Well, you got to remember that paramedics are exposed to all kinds of stuff.
Right.
Biohazards, infectious diseases,
Yeah.
all kinds of risks. By taking those precautions, they're not just protecting themselves.
Right.
They're protecting their patients and the whole community.
It's kind of like that saying, you can't pour from an empty cup, right?
Exactly.
You have to take care of yourself.
You can't help anyone if you're sick or injured yourself.
Right, exactly.
And that focus on safety goes beyond just PPE.
Okay.
The standards also talk about safe equipment use and disposal.
Okay.
especially when it comes to sharps.
Right, like needles and things like that.
Exactly.
Because a stray needle could be a serious problem.
For anyone.
Yeah, absolutely.
It's not just about the patient.
What other things in this section kind of jumped out at you?
You know, one thing I thought was interesting is that they actually have to introduce themselves to the patient
Okay.
and anyone else who's at the scene.
So it's about making a connection.
Yeah, it's about recognizing that the patient is a person,
Right, not just a case.
even in the middle of a crisis.
Yeah.
And it just kind of sets the tone for respectful care.
And then there's the whole issue of consent.
Right. Of course.
The General Measures Standard specifically talks about getting consent for patient care.
Yeah.
And they even reference the Ontario Healthcare Consent Act from 1996.
Yeah, that's a really important part of it.
Okay.
So before they provide any treatment,
Okay.
paramedics have to get informed consent from the patient
Okay.
or their substitute decision maker
Right.
if the patient can't consent for themselves,
Okay.
which makes sense in most cases.
Right.
But what about in an emergency
Yeah.
when you don't have time?
What if the person is unconscious?
Right. Exactly.
Or they just can't communicate clearly?
That's when things get a lot more complicated.
Right.
And paramedics really have to rely on their training
Okay.
and their judgment
Okay.
to decide what's best for the patient,
Okay.
even if they can't get that explicit consent.
So how do they approach those situations?
Well, whenever possible, they'll try to get family members or caregivers involved. You know, people who might be able to give some insight
Yeah.
into what the patient would want or
Yeah.
how they usually make decisions.
Okay.
But in the end, their primary duty is to act in the patient's best interest,
Okay.
even if that means making a tough call,
Yeah,
but
yeah.
without having that clear consent.
Wow, those situations sound really challenging.
They are.
And I think it shows that paramedics are dealing with so much more
Oh, absolutely.
than just physical injuries.
It's not just about bandages and medicine.
Right.
It's about navigating these really complicated social and ethical situations.
Absolutely.
It takes compassion and critical thinking
Mhm.
and a real commitment to being there for your patients.
All right, so we talked about PPE,
Yeah. Yeah.
introductions and consent.
Right.
What else does this General Measures Standard cover?
Well, it also talks about using proper communication techniques
Okay.
to build trust with the patient.
So it's not just about being polite, it's more than that.
It's about really listening to the patient,
Okay.
showing empathy. Yeah.
And explaining things clearly,
Right.
especially in a stressful situation.
Yeah, because all that medical jargon can be confusing.
Exactly.
Right.
Especially when you're scared and not feeling well.
So clear, compassionate communication
It can make a world of difference.
can really change how the patient experiences that whole interaction.
Absolutely. It can calm them down,
Okay.
reduce their anxiety,
Okay.
and even make them more cooperative with the treatment.
Which is important.
Absolutely.
The standard also mentions protecting the patient from hazards and like bad weather and stuff.
Right.
What does that actually look like in practice?
That could be anything from moving the patient to a safer spot
Okay.
to shielding them from the rain or the snow,
Right.
or even just giving them a blanket
Okay.
or pain relief.
So it's about going beyond just the medical stuff.
Yeah, it's recognizing that even those small things
Right.
can make a big difference in how the patient experiences the situation.
It's amazing how much thought and care goes into this. It really is.
Are there any other details in this section you think people should know about?
There's one point about referencing the Transport Canada Emergency Response Guidebook
Okay.
for situations involving hazardous material.
So they need to be ready for more than just a heart attack.
Exactly. They're often the first ones on the scene.
Right.
And they need to be able to handle all kinds of situations,
Okay.
including those involving dangerous materials.
So,
That guidebook gives them all the info they need to identify those materials,
okay.
understand the risks, and keep everyone safe.
So it's another reminder of just how diverse the challenges are
Mm-hmm.
that paramedics face.
Yeah, and how much knowledge they need to have.
And then finally, the standard ends with a really simple instruction.
What's that?
Perform hand hygiene.
Right.
Again, it might seem obvious,
Yeah.
but why is it in there?
Because washing your hands is
Yeah.
one of the best ways to prevent the spread of infection.
Okay.
And paramedics are constantly interacting with patients, often in environments that aren't exactly sterile.
Yeah.
So hand hygiene is extremely important.
It's a reminder that even those little things, when you do them consistently,
Mm-hmm.
can have a big impact.
Absolutely.
It really speaks to the professionalism and the commitment behind everything paramedics do.
They're not just treating individuals, they're
Yeah.
contributing to the well-being of the entire community.
It's really inspiring to see that level of dedication.
It is.
So we've talked about the ethical framework they operate under,
Mm-hmm.
the specific things they do on every call,
Right.
and their commitment to safety and patient care.
It's incredible how much we can learn
I know, right?
from these standards.
Absolutely. And we've only scratched the surface.
We've just started.
We'll be back in a moment to wrap up our deep dive into the world of paramedic standards.
Okay.
Stay tuned. Welcome back to our deep dive into the world of paramedic standards. It's amazing how these documents, which might seem, just like a bunch of rules at first glance, actually reveal a lot about the human side of emergency care.
It's true. Yeah, we've seen how these standards go way beyond just the medical procedures themselves.
Right.
They really outline this whole ethical framework that
Yeah.
guides paramedics in basically every interaction they have with
Yeah.
patients, with the public, even with their colleagues.
Right. From that focus on maintaining a patient's dignity to all those strict confidentiality rules,
Yeah.
it's clear that building and keeping that trust
Mhm.
is at the heart of this whole profession.
It really is.
But what's also really interesting to me is how these standards show just how much decision-making goes into every call.
Right.
It's not just following a list.
Oh, absolutely not.
Paramedics have to constantly use their judgment,
Mm-hmm.
adapt to all these unexpected situations,
Right.
and always keep the well-being of their patients front and center.
You've put it perfectly. They have to find that balance
Yeah.
between sticking to protocol
Right.
and responding effectively to whatever's happening.
Right, because you never know what you're going to walk into.
Exactly. They need to be prepared for anything,
Yeah.
whether it's a hazardous materials spill or a really complex. Well, whenever possible, they'll try to involve family members or caregivers,
Okay.
people who might be able to, provide some insight into what the patient would want
Yeah.
or how they usually make decisions.
Right.
But ultimately, their main responsibility is to do what they think is best for the patient,
Okay.
even if it means making a difficult decision
Right.
without that explicit consent.
It sounds like it takes a lot of sensitivity
It does. It's not easy.
to navigate those gray areas.
And those scenarios really underscore the fact
Yeah.
that paramedics are dealing with so much more than just physical injuries,
Yeah.
They're navigating these complex social and ethical dilemmas,
Right.
which requires a lot of compassion, critical thinking skills, and a real commitment to advocating for those patients.
Well, this has been such an eye-opening conversation.
It has been. It's fascinating stuff.
I think we've all gained a much deeper appreciation
Yeah,
for the incredible work that paramedics do.
absolutely. The training and dedication and all the ethical considerations that go into every response.
The next time I see an ambulance,
Yeah.
I'll definitely be thinking about all the expertise and care
Mhm.
that's happening behind the scenes.
I think that's a great takeaway for all of us.
Well, it looks like we've reached the end of our deep dive
Yeah, time flies.
into the world of paramedic standards.
It really does.
Thanks for joining us.
Thanks for having me.
And until next time, keep diving deep. Welcome back, everyone. We're diving deep into the world of stroke protocols today. Specifically, we're going to unpack the cerebrovascular accident standard and the acute stroke bypass protocol.
These protocols, they really outline the essential steps that paramedics take when they encounter someone who might be having a stroke.
It's pretty intense stuff, lots of medical jargon. But don't worry, we're here to break it all down, make it understandable, and maybe even, a little bit fascinating.
Right. Absolutely. It is fascinating. When you start to peel back the layers and see the thought process behind these protocols, it's really amazing, like how paramedics make these split-second decisions that can literally save lives.
Yeah, it's all about time, isn't it? Like how every second counts when you're dealing with a stroke.
Absolutely. Time is brain, they say, and that's really true in this context.
Okay, so one thing that really jumped out at me when I was going through these protocols was how much emphasis there is on ruling out other conditions that could mimic stroke symptoms.
Yeah, that's crucial. Paramedics, they can't just assume it's a stroke, right? They have to be like medical detectives ruling out other possibilities.
It's like a puzzle, figuring out what's really going on.
Exactly. And, sometimes what looks like a stroke could be something totally different, like hypoglycemia, low blood sugar, for example.
You're telling me someone could have stroke-like symptoms, but all they need is like a sugary drink.
Sometimes, yeah. It happens more often than you might think.
Wow, that's wild. So that initial assessment, It's got to be super thorough.
Absolutely. And it's not just hyperglycemia they have to consider, right? The protocol lists a whole bunch of other mimickers.
Like what? Give me some examples.
Well, you've got drug ingestion, could be anything really, even cocaine.
Okay, seriously.
Yeah, it can cause symptoms that mimic a stroke. Then there's severe hypertension, really high blood pressure, and even some infections, like infections of the central nervous system.
So paramedics are essentially running through this mental checklist, right?
Yeah.
Making sure they're not missing anything.
You got it. And that checklist, it leads them to the secondary survey, which is like a more detailed assessment. They're checking things like facial symmetry, making sure both sides of the face are moving the same way.
Oh, right. Like if one side is drooping? That's a classic stroke symptom, isn't it?
Exactly. They're also looking at pupil responses, how the pupils react to light, and listening to the patient's speech, looking for any slurring or difficulty finding words.
Right, right. What else are they checking?
They'll check for neck stiffness because that could be a sign of something else going on, like meningitis. And then they're testing motor function, how well the patient can move their arms and legs.
So like checking their grip strength and things like that.
Yeah, exactly. They're also checking for sensory loss, like can the patient feel touch on both sides of their body? And they might even check for incontinence, loss of bladder control.
Wow. It's amazing how systematic they have to be, even under all that pressure.
It's all about having a system, a process to follow. And that systematic approach, it doesn't stop with just identifying potential stroke symptoms. It also extends to anticipating problems that might arise.
Like what kind of problems?
Well, for example, the protocol specifically mentions airway obstruction. Someone having a stroke, they might lose control of their tongue, and that can block their airway.
Oh, wow. I hadn't thought of that.
It's one of those things you have to be prepared for. And then there's decreasing consciousness, seizures, and even agitation or combativeness.
So by anticipating these potential complications, paramedics can, act quickly to keep the patient safe.
Exactly. It's all about being one step ahead, thinking about what could happen, and being ready to respond.
Yeah, and speaking of thinking ahead, I noticed there's a whole section in the protocol dedicated to ventilation. Why is that so important in stroke cases? What's the connection?
Well, it's all about making sure the brain gets enough oxygen. See, when someone has a stroke, it disrupts blood flow to a part of their brain, right? And blood carries oxygen. So maintaining those oxygen levels is absolutely crucial, especially when blood flow is compromised.
That makes sense.
Yeah.
The brain needs oxygen to function, just like every other organ in the body. And the protocol, it even gets specific about maintaining certain EtCO2 levels. They talk about aiming for 35 to 45 millimilli Hg normally. But if there's something called cerebral herniation, then they lower that target to 30 to 35 millimilli Hg.
Right. Cerebral herniation, that's a very serious condition. Essentially, it's when pressure builds up inside the skull and it pushes parts of the brain into spaces where they shouldn't be.
Wow, that sounds really dangerous.
It is. It's life-threatening. And paramedics have to be very careful about how they manage that pressure. That's why they adjust their ventilation strategy if they see signs of herniation.
So they're walking a tightrope, basically. Trying to maintain oxygen levels, but also trying to avoid increasing pressure in the brain.
Exactly. It's a very delicate balance.
Okay, so we've talked about oxygen and ventilation. Now let's move on to something that sounds a little bit like a secret code. The LAMS, the Los Angeles Motor Scale. What is that all about?
Think of it like a tool that paramedics use to quickly assess the severity of a potential stroke. Specifically, they use it to help identify what are called large vessel occlusion strokes, or LVOs.
What are LEOs?
They're strokes caused by a blockage in one of the large arteries that supply blood to the brain. They tend to be more severe than strokes caused by blockages in smaller vessels.
So the LAMS helps paramedics figure out if they're dealing with one of these more serious types of strokes.
Exactly. And it's pretty simple, actually. They're looking for specific symptoms, things like whether the patient can speak properly or if they're using the wrong words, or maybe they can't speak at all.
So like slurred speech, difficulty finding words, or just being completely mute?
Yep, that's part of it. They're also checking for arm or leg weakness on one side of the body.
Like if one arm is weaker than the other, or if one leg is dragging?
Exactly. And of course, they're looking for facial droop, which we already talked about.
Right, that's a pretty well-known stroke symptom.
It is. So they look for those four things: speech problems, arm weakness, leg weakness, and facial droop. And each of those gets a score, either a 0 or a 1.
So the higher the score, the more severe the stroke is likely to be.
Exactly. A score of 4 or more, that's a big red flag. It means there's a high probability of an LVO, and it triggers rapid transport to a specialized stroke center.
So it's not just about identifying a stroke, it's about figuring out how serious it is and getting the patient to the right place as quickly as possible.
That's it. And paramedics, they actually communicate that LAM score directly to the receiving hospital.
So it's like a heads up, like, hey, we've got a potential LVO coming your way, get ready.
Exactly. It's vital information that helps the hospital prepare.
Makes sense. So we've talked about recognizing stroke symptoms and using the LAMs to gauge severity. But what about actually getting the patient to the hospital? That's where the acute stroke bypass protocol comes in, right?
You got it. That protocol is all about speed, getting the patient to the right facility as quickly as possible.
Because time is brain. Right?
Absolutely. There's a critical window of opportunity for intervention, what they call the golden hour. And this protocol helps paramedics maximize that time window.
So what are the criteria for activating this protocol? What has to happen for a paramedic to say, okay, we're going with the bypass protocol?
Well, first, the patient has to have at least one of those LAM symptoms we talked about.
Yeah.
The speech problems, the weakness, the facial droop.
Right, so there has to be some indication of a potential stroke.
Yeah. And then the other big thing is that the patient has to be transportable to a designated stroke center within 6 hours of when the symptoms started.
6 hours. Wow, that seems like a really tight window.
It is. Every minute counts. But there are also some situations where this bypass protocol wouldn't apply. They call them contraindications, like if the symptoms resolved before the paramedics arrive, for example.
Yeah, that makes sense. If the symptoms are gone, there's no need to rush. Right.
Right. But some of the other contraindications are a bit more nuanced. Like, let's say the patient has a blood glucose level below 3 millimole. That's really low blood sugar.
Oh, right. Hypoglycemia. We were just talking about that.
Yeah.
But wouldn't they still activate the bypass protocol in that case? I mean, isn't time still of the essence?
It is, but in that situation, the priority would be to correct the hypoglycemia first. Give them some glucose, get their blood sugar back up to a safe level.
Because, like we said, low blood sugar can mimic stroke symptoms.
Exactly. So it's not just about speed, it's about making sure you're addressing the right problem.
I see. So what are some other contraindications?
Well, if the patient had a seizure when the symptoms first started, that would be a contraindication. Or if they have a low score on the Glasgow Coma Scale, which is a way of measuring consciousness.
So basically, if there are signs that something else might be going on, something more complex than a simple stroke, they might not activate the bypass protocol.
That's right. It's about making sure the patient gets the most appropriate care for their specific situation.
Okay, that makes sense. So we've talked about recognizing stroke symptoms, assessing severity, and deciding when to activate the bypass protocol. Now, what about these designated stroke centers? The protocol mentions different types: regional, district, telestroke centers. Why are there different types?
Because different centers have different capabilities. It's all about matching the patient's needs with the resources available at the hospital.
So, like, some stroke centers are more equipped to handle complex cases than others.
Exactly. Regional stroke centers, for instance, they're usually the most comprehensive. They offer a full range of treatments, including things like endovascular thrombectomy or EVT.
Hold on, EVT, what is that?
It's a procedure where they actually go in and remove the clot that's causing the stroke. They thread a tiny catheter through the blood vessels all the way up to the brain.
Wow, that's amazing. Like a tiny plumber for the brain.
Exactly. But not every hospital has the capability to do that procedure.
Right, right. So paramedics have to know which hospitals have what capabilities.
Exactly. And the protocol, it talks about transporting the patient to the most appropriate facility. But what does that really mean?
Yeah, I was wondering about that. Wouldn't the closest stroke center always be the most appropriate?
Not necessarily. Sometimes it makes sense to bypass a closer center and take the patient to one that's a bit farther away but has more specialized capabilities, like EVT.
So it's not just about speed, it's about making sure the patient gets to the right place, the place that can provide the best care for their specific type of stroke.
Exactly. It's about weighing all those factors and making the best decision in the moment.
It sounds like a really tough job.
It is. It's high pressure, but it's also incredibly rewarding.
Now, here's a question that popped into my head while I was reading the protocol. What if the patient's symptoms start to improve or even disappear completely while they're on the way to the hospital? Would the paramedics turn around and go to a closer facility?
That's a great question, and it's something the protocol specifically addresses. Even if the symptoms improve, they still continue transport to the designated stroke center.
Really? Why is that? Wouldn't it make sense to reevaluate and maybe go to a closer hospital if the situation seems less urgent?
It might seem counterintuitive, but there's a good reason for it. Just because the symptoms improve, it doesn't mean the danger is past.
Oh, I see. So it's like better safe than sorry.
Exactly. Continued monitoring is essential, and the team at the designated stroke center, they're the best equipped to figure out what happened, why the symptoms occurred in the first place.
And to provide any necessary follow-up care.
You got it.
Well, I feel like we've only just scratched the surface of this whole pre-hospital stroke care thing. It's way more complex than I ever realized.
It is. There's a lot more to unpack, for sure. Welcome back to the deep dive. We're picking up right where we left off, exploring the intricacies of pre-hospital stroke care.
I'm ready for more.
Ugh.
Last time we were talking about all those factors that go into getting patients to the right facility fast. But what happens once those paramedics actually arrive on scene? Are there specific treatments they can start right then and there in those first few minutes?
There are. And it might not be what you'd expect. One of the first things paramedics might do is give the patient aspirin.
Aspirin. Really? I always thought that was just for, like, headaches. I wouldn't think that would be a top priority in a stroke situation.
It might seem surprising, but aspirin actually plays a pretty important role in stroke care. It helps prevent blood clots from getting bigger, you see.
So it's all about, like, keeping that blood flowing as much as possible.
Exactly. And the protocol, it gets pretty specific. It recommends a dose of 160 to 325 milligrams.
Okay. And there's more, isn't there? Something about how the aspirin should be taken.
Right. The protocol actually emphasizes that chewing the aspirin instead of swallowing it whole leads to faster absorption.
Interesting. So it's not just about giving the medication, it's about how to administer it for maximum effect. Do paramedics have, like, a whole toolkit of medications they can use out in the field for stroke?
It's a little more complicated than that. The protocols mention that paramedics can use other medications based on what they call offline medical direction or regional-based hospital protocols.
Okay, that sounds a little cryptic. Can you break that down a bit? What does that actually mean in practice?
Sure. Essentially, it means that paramedics have some flexibility in what they can do, depending on the specific circumstances and regional guidelines.
So it's not a one-size-fits-all approach.
Right. They might be able to, say, consult with a physician remotely or follow predetermined protocols that allow for the use of medications beyond just that initial aspirin dose.
I see. So they have options, but those options are guided by specific protocols and consultations with medical professionals.
Exactly. It's a dynamic process, and it's tailored to each individual patient's needs. And, another big factor they're always considering is blood pressure.
Blood pressure.
Yeah.
Yeah, that's something I definitely associate with strokes. But why is it so important?
Well, think about it. It all comes back to that blood flow to the brain. If the blood pressure is too high, it can make things worse, especially if the stroke is hemorrhagic.
Hemorrhage? You mean like a bleeding stroke?
Exactly. Hemorrhagic strokes are caused by a ruptured blood vessel in the brain, so high blood pressure could make that bleeding even worse.
Right, so high blood pressure in that case would be a bad thing. But what about if the blood pressure is too low?
That's a problem too, especially with ischemic strokes.
Ischemic strokes. Remind me what those are again?
Ischemic strokes are the most common type. They're caused by a blockage in a blood vessel, cutting off blood flow to part of the brain. And if the blood pressure is too low, well, that just makes it even harder for blood to get through.
So it's a balancing act, right? Too high or too low, and you could be making the situation worse. So are there specific guidelines for blood pressure management in stroke patients? Like, what are paramedics aiming for?
That's where things get a bit tricky. The protocol doesn't give any hard and fast rules about blood pressure because it really depends on the individual patient and their specific situation. It emphasizes that paramedics should rely on that offline medical direction we talked about earlier and their own assessment of the patient's overall condition.
So they have to make some judgment calls based on their training and experience.
Exactly. They have to consider the type of stroke, the patient's medical history, their current vital signs, any other symptoms they're experiencing. It's a lot to take in.
Yeah, it sounds like it. They really have to be on top of their game. And then on top of all that, they got to get the patient to the hospital safely, which I imagine has its own challenges, especially in an emergency situation.
Oh, absolutely. The protocol actually highlights something they call minimizing scene time. Basically, that means getting the patient on their way to the hospital as fast as possible, but obviously doing it safely.
Right, because rushing can lead to mistakes, and you don't want to make things worse. So what are some of the specific considerations when transporting someone who's having a stroke? Like, what are paramedics paying attention to?
Well, for one, they're very careful about positioning the patient. They need to make sure the patient's body and limbs are properly supported, especially if there's any weakness or paralysis.
That makes sense. And I imagine monitoring is pretty crucial throughout the whole transport.
Absolutely. Paramedics are constantly checking vital signs, assessing neurological status, looking out for any changes or complications that might pop up along the way.
So they're like the eyes and ears and the hands all at the same time. It sounds exhausting.
It can be, for sure. They're also in constant communication with the receiving hospital, providing updates on the patient's condition and making sure everything's ready for their arrival.
It's like a well-oiled machine, everyone working together. So it's not just about getting the patient from point A to point B. It's about creating a smooth transition of care from the field to the hospital.
Exactly. It takes teamwork and communication to make sure everything runs smoothly and the patient gets the best possible outcome.
You know, there's a topic that we need to address, and it's not an easy one. It's end-of-life care in the context of stroke. It's a sensitive subject, but it's important to understand how these protocols address those situations.
You're right. It's not an easy conversation, but it's a necessary one. And the protocol does address situations where a patient might be in palliative care or considered terminally ill.
So how does the acute stroke bypass protocol apply in those cases? Would a patient who's terminally ill still be rushed to a specialized stroke center?
Not necessarily. Actually, those situations are listed as contraindications for the protocol.
So if a patient is already receiving palliative care, the focus might shift away from aggressive interventions like rushing them to a stroke center.
Exactly. In those situations, the priority becomes providing comfort care and respecting the patient's wishes and any existing care plan they might have in place.
It's about recognizing that aggressive treatment might not align with the patient's overall goals of care in those specific circumstances.
Absolutely. And it really highlights how important it is for there to be open communication between paramedics, the patient, and their family, especially when it comes to making these difficult decisions out in the field.
It's a reminder that stroke care goes beyond medical procedures and protocols. It's also about human compassion and understanding each patient's individual needs and wishes.
Couldn't have put it better myself.
Okay, so we've covered a lot of ground here. We've talked about medications, blood pressure management, considerations for transport, even end-of-life care. It's clear that pre-hospital stroke care is multifaceted, to say the least.
It is, and we've really just scratched the surface. But there's one crucial element we need to explore further. Communication.
Communication.
Yeah.
We've already talked about paramedics communicating with each other and with the hospital. What else is there?
Well, there's the communication between paramedics when they're working together on scene, how they coordinate their efforts. Then there are the specifics of what information they relay to the hospital. And we can even dive deeper into the importance of communicating effectively with the patient and their family. All of that is crucial.
We're back, and it's time to wrap up our deep dive into the world of stroke protocols. And as we were just saying, this time it's all about communication.
You know, it's easy to get caught up in all the medical details, all the procedures and protocols, but communication, it's really the glue that holds everything together in emergency medical response.
Especially when you're dealing with something as time-sensitive as a stroke.
Absolutely. Every second counts, and clear, effective communication can literally be the difference between a good outcome and a tragic one.
Okay, so let's start with communication between paramedics themselves. You know, they're out there in the field, working as a team. What kind of information are they sharing with each other in those critical first moments?
Well, the most important thing is the patient's condition, of course. They're constantly relaying information about vital signs, describing symptoms, sharing what they observed during that initial assessment.
So it's like a constant flow of information between them.
Exactly. And it's not just verbal communication either. They're also using nonverbal cues, body language, hand signals, anything to convey information quickly and efficiently.
Wow, so they really have to be in sync.
They do. It's about working together seamlessly, anticipating each other's needs, being a cohesive unit, even when things are chaotic.
Now, let's zoom out a little bit and talk about communication with the receiving hospital. We touched on this earlier, but I'm curious to know more about why it's so important in the bigger picture of stroke care.
Well, because it allows the hospital team to prepare for the patient's arrival. Remember the golden hour we keep talking about, that critical window of time for intervention?
Yeah.
Effective communication is key to maximizing that window. It's like giving the hospital a head start so they can hit the ground running when the patient gets there.
So what kind of information are paramedics giving to the hospital? Is it just a quick, heads up, or is it a more detailed report?
Oh, it's definitely more than just a heads up. Paramedics are giving a pretty comprehensive report. They're relaying vital signs, their initial impression of the type of stroke, the LAM score, any medications they've given, all of that.
And I imagine they're giving an estimated time of arrival, too.
Absolutely. That way, the hospital can activate their stroke team, get all the necessary personnel in place, prepare any special equipment they might need.
Like those imaging scanners or the tools they use for EVT.
Exactly. It's all about minimizing delays and ensuring a smooth transition of care.
Okay, so communication between paramedics, communication with the hospital, check and check. But now let's talk about what's probably the most challenging, but also the most important piece of this communication puzzle. Talking to the patient and their family.
It's definitely a delicate balance. You have to convey the seriousness of the situation, the urgency of getting to the hospital, but you also have to do it with compassion and empathy.
It must be so hard to find the right words in that moment when everyone's stressed and scared.
It is. But communicating effectively with the patient and their family, it can make a world of difference. It can help calm them down, build trust, make sure everyone's on the same page.
So what kind of things are paramedics saying to the patient and their family in those initial moments?
Well, they're explaining what's happening, but in simple terms that anyone can understand. Describing the signs of a stroke, outlining the steps they're taking. They're also taking the time to answer any questions, address any concerns that the patient or the family might have.
And I imagine they're providing some emotional support too. Because a stroke, it can be a terrifying experience, not just for the patient, but for their loved ones as well.
Absolutely. Paramedics are trained to provide comfort and reassurance, to offer a sense of hope, even in a crisis.
They're like the calm in the storm.
That's a good way to put it.
Well, as we wrap up this deep dive into the world of stroke protocols, what's the one key takeaway you want our listeners to remember?
I think it's that stroke care is a team effort. It's a complex dance that involves rapid assessment, timely intervention, and of course, seamless communication at every level.
And it's a dance where every step matters. From those initial observations and conversations between paramedics to the transport to the hospital to those crucial interactions with the patient and their family.
Exactly. It's really a testament to the skill, the dedication, and the compassion of everyone involved in stroke care.
And to our listener who requested this deep dive, we hope this is giving you a better understanding of just how complex and multifaceted pre-hospital stroke care really is.
And maybe even a newfound appreciation for the amazing work that paramedics do every day.
Knowledge is power, as they say.
Oh.
So the more you know about stroke, the better prepared you'll be to recognize the signs, get help quickly, and advocate for yourself or a loved one if that need ever arises.
Absolutely.
Thank you for joining us on this exploration of the world of stroke care. Until next time, stay curious, stay informed, and stay well. Ever wonder what goes through a paramedic's mind
Oh, yeah.
when they arrive at like a medical emergency?
Mm-hmm.
It's more than just rushing you to the hospital, right?
Right.
Today, we're going to go deep on the protocols they use,
Okay.
especially for those like heart-stopping,
Literally.
literally heart-stopping situations like suspected heart attacks and strokes.
Their protocols are fascinating.
Really?
They're like condensed wisdom.
Oh, wow.
Years of research just like boiled down
Wow.
to these quick guides that paramedics use right there in the field.
So we're talking about the actual paramedic prompt cards.
Yes.
Like, think cheat sheets for these like
Uh-huh.
high-stakes situations.
Oh, states.
We'll uncover what must be present
Okay.
for a patient to qualify
Interesting.
for these special protocols and the surprising things
Mhm.
that might disqualify someone even if they seem seriously ill.
Right.
And get this,
Okay.
sometimes a longer ambulance ride might
Oh.
actually be the better choice.
Yeah.
Buckle up, because this is where it gets interesting.
Exactly. These cards aren't just about like recognizing an emergency.
Right.
They lay out very specific criteria.
Okay, so let's start with heart attacks.
Okay.
The prompt card mentions a STEMI hospital bypass protocol.
Mm-hmm.
What's a STEMI and why all fuss?
So STEMI stands for
Wow.
ST elevation myocardial infarction.
Okay.
Picture this. A major artery feeding your heart muscle
Right.
gets completely blocked.
Oh, wow.
That's a serious heart attack.
Yeah.
The ST elevation
Right.
refers to a pattern seen on an electrocardiogram
Mm-hmm.
or ECG, which paramedics use right there on the scene
Wow.
to diagnose this.
So the ECG is key.
Yes.
What I found interesting is that the patient has to be 18 or older
Yeah.
for this protocol to even apply.
Mm-hmm.
Why would age matter so much in a heart attack?
That's a great catch.
Yeah.
STEMI is usually caused by plaque buildup in the arteries,
Right.
something that takes time to develop.
Oh, okay.
It's much less common. Yeah.
In younger people.
So younger people wouldn't.
There are other causes.
Yes.
but they might not show that classic STEMI pattern on the ECG.
Wow. So paramedics are doing on-the-spot cardiology out there.
Yeah.
The card mentions they look for ST elevation in specific leads,
Yes.
like V1, V3.
Uh-huh.
That sounds like a foreign language to me.
Think of those ECG lead like cameras pointed at your heart at different angles.
Okay.
V1, V3 are right over the front of the chest,
Gotcha.
capturing the heart's electrical activity.
Okay.
Big ST elevation there.
Mm-hmm.
High chance of a blockage in a critical artery.
Okay, that makes sense.
Yeah.
But here's a curveball.
Okay.
The card says even if the ECG later looks normal,
Mm-hmm.
once the STEMI protocol is activated,
Right.
they stick with it.
Oh,
Why wouldn't they change course if things seem to have improved?
that's where it gets really interesting.
Oh, really?
Sometimes the ECG changes in a STEMI are fleeting.
Oh, wow.
The blockage might shift
Yeah.
temporarily.
Blood flows again and the ST elevation vanishes.
Hmm.
Sounds good, right?
Right.
Not so fast.
Oh.
That artery is still dangerously narrow
Oh, wow.
and could clog up again.
Oh, geez. In a minute. So playing it safe is key.
Yeah.
Now for the real head scratchers.
Okay.
Things that can disqualify someone from this fast-track protocol,
Mm-hmm.
even if they look like they're having a major heart attack.
Some might seem surprising,
Right.
but there's always a solid reason behind it.
Okay.
The goal is
No, no.
getting you the most appropriate care
Yeah.
as quickly as possible,
Uh,
even if that means a detour from the initial plan.
For example, the card says even someone needing top-level care,
Yeah.
what they call CTS1,
Uh-huh.
can be disqualified if they have airway issues.
Mm-hmm.
That seems counterintuitive.
Yeah.
Shouldn't they be rushed to the cardiac center?
Think of it this way. If
Okay.
you can't breathe,
Yeah.
that's an immediate life-threatening
Yeah,
problem.
right.
Stabilization comes first. Even before specialized cardiac care,
Right.
airway management might require techniques and equipment
Okay.
not immediately available at a specialized cardiac center.
Gotcha.
Getting to the nearest hospital, even
Yeah.
if it's not the cardiac one,
Right.
becomes the priority.
So it's about stabilizing the immediate threat first?
Right. Right.
What about this left bundle branch block?
Mm-hmm.
That sounds terrifying.
It does sound scary,
Yeah.
but it's actually an electrical problem in the heart,
Oh, okay.
not a blocked artery like in a STEMI.
right.
The tricky part is it can mimic a STEMI on the ECG,
Right.
showing ST elevation
Uh-huh.
even when there's no heart attack happening.
So a false alarm,
Yeah,
but one that needs a different approach.
exactly.
And I see time plays a huge role here.
Yes.
Over 60 minutes to that specialized PCI center,
Mm.
and you're out of luck for the bypass.
Right.
Why such a strict cutoff?
Remember, time is muscle when it comes to a STEMI.
Yep.
Every minute without oxygen, more heart muscle gets damaged.
Wow.
PCI, or percutaneous coronary intervention, is the gold standard treatment.
Okay.
Imagine a tiny catheter threaded through your arteries
Right.
to the blockage.
Okay.
A balloon inflates,
Uh,
or a stent is placed to open it up.
wow.
But this needs to happen fast
Right.
to minimize damage
Yeah.
beyond 60 minutes.
Yeah.
Bypassing a closer hospital for that specialized center
Right.
becomes riskier.
Makes sense.
Yeah.
Here's what I don't get.
Okay.
The card lists complications like trouble breathing
Mm-hmm.
and low blood pressure as disqualifiers too.
Right.
These seem like things that would need a hospital ASB.
Yeah.
So why not go straight to the cardiac center?
Those are serious, no doubt.
Right.
But they often need different specialists and resources
Okay.
than a specialized cardiac center might have readily available.
Right.
Someone struggling to breathe might need a ventilator,
Gotcha.
which might not be a cardiac team's primary expertise.
Right.
Someone with dangerously low blood pressure might need medications and interventions. A cardiac center
Okay.
might not be fully equipped to handle immediately.
So it's about matching the patient's needs
Yes.
to the right resources,
Yes.
even if the route is a bit longer.
Exactly.
And that brings us to another key point.
Okay.
These cards aren't set in stone.
Right.
There's a note about situations where even if the transport time is over 60 minutes,
Yeah.
the specialized cardiac center
Right.
might still approve the transfer.
Yeah.
Ultimately, it's a judgment call,
Right.
collaboration
It is.
between the paramedics and the receiving hospital
Uh-huh.
to figure out the best move for each
Okay.
individual patient.
For each individual patient.
So even with guidelines, there's room for flexibility
Yes.
and personalized decisions.
Absolutely. Every patient is unique, and
Yeah.
these protocols are guides,
Yeah.
not rigid rules.
Mhm.
Paramedics are trained to assess each situation carefully and make informed decisions
Right.
based on the specific circumstances.
That's reassuring to know.
Yeah.
Now let's shift gears to stroke protocols.
Okay.
They have their own set of twists and turns, don't they?
They do.
Really?
And while there are some similarities to the STEMI protocol,
Right.
strokes bring their own challenges in terms of diagnosis and treatment,
Okay.
which is reflected in how these protocols are structured.
Let's dive into that.
Okay.
The prompt card mentions designated stroke centers,
Mm-hmm.
and it seems like not all hospitals are created equal
Right.
when it comes to stroke care.
That's right.
Okay, so
You've got regional stroke centers, the most comprehensive ones with advanced imaging,
okay.
neurology specialists,
Wow.
and often neurosurgical capability.
Gotcha.
Then there are district stroke centers,
Okay.
offering a more basic level of care.
Right.
And we can't forget telestroke centers,
Interesting.
using telemedicine to connect patients in remote areas
Oh, wow.
with stroke specialists.
So it's like a tiered system
Yeah,
with the most serious cases going to the top tier.
right.
But how do paramedics even know they're dealing with a stroke in the first place?
Yeah,
Those symptoms can be pretty subtle, right?
you're right.
Yeah.
Stroke symptoms can be quite varied
Mm-hmm.
and sometimes mimic other conditions.
Yeah.
But that's why the prompt card lists key things
Yeah.
paramedics look for.
Gotcha.
And even one of these can raise suspicion.
Let's break those down.
Okay.
The classic one is weakness on one side of the body.
Exactly.
Like that droop you sometimes see.
Sudden weakness or paralysis on one side is a
Mhm.
hallmark.
Right.
But it's not just weakness.
Uh.
Sometimes it's numbness or a loss of sensation.
Then there's speech problems.
Right.
But it's not just slurring, is it?
No.
The card mentions using the wrong words or even being totally unable to speak.
That's right.
Wow.
It's called aphasia,
Okay.
a language disorder that can happen when the brain areas responsible for speech and language are damaged.
Oh, wow.
It can range from difficulty finding words
Right.
to a complete loss of speech.
So it can be much more than just slurring.
Right.
And of course, there's the facial droop,
Yes.
typically on one side.
Another classic sign.
Right.
It happens when the muscles on one side of the face weaken or become paralyzed,
Right.
making it hard to smile, raise an eyebrow, or even close the eye on that side.
So even one of these is enough to raise a red flag.
Yeah,
And then there's the whole 6-hour window for treatment.
right.
I've heard about that for years.
Mm-hmm.
But the card clarifies it's not from when the symptoms started,
Uh-huh.
but from when the person was last seen normal.
Correct.
Why is that distinction so important?
It boils down to the treatments available for stroke
Yeah.
and when they work best.
Right.
The most crucial window is for a procedure called thrombectomy, essentially a tiny roto-rooter for the brain.
Oh, wow.
A catheter is threaded through the arteries to the blockage
Right.
and physically removes the clot.
Okay.
For it to be successful, it needs to be done quickly,
Right.
ideally within 6 hours
Yeah.
of the onset of symptoms.
Okay.
But often people don't know exactly when their stroke started, especially if they were alone.
Right.
That's where last seen normal comes in.
Gotcha.
It gives doctors a more reliable estimate of
Right.
when the stroke likely occurred.
So it's about maximizing the chances of getting that
Yes.
clot-busting treatment in time.
Exactly.
But then the card mentions large vessel occlusion.
Right.
That sounds ominous.
It is.
Yeah.
A large vessel occlusion, or LVO,
Mm-hmm.
means a blockage in one of the major arteries
Like,
supplying blood to the brain.
gotcha.
These are the most severe strokes,
Yeah.
often causing significant damage and disability.
I see paramedics use a special scale to assess this,
Yes.
the LAM score. It even mentions that a score of 4 or higher
Right.
can change the patient's priority level?
Exactly. The
Okay.
Los Angeles Motor Scale, or LAMS,
Right.
is a quick assessment
Mhm.
to gauge the severity of stroke symptoms,
Okay.
focusing on the patient's ability to move their arms, legs, and face.
Okay.
A score of 4 or higher suggests
excellent.
a higher likelihood of an LVO,
Yeah.
making it even more urgent
Right.
to get the patient to a specialized stroke center
Right.
equipped for thrombectomy.
So it's about identifying the patients who need the most advanced care as quickly as possible.
As quickly as possible.
What about stroke protocol disqualifiers?
Okay.
Are they similar to the heart attack ones?
There are some overlaps.
Okay.
Just like with STEMI,
Yeah.
if there's an uncorrected airway,
Yeah.
breathing, or circulation problem
Right.
that takes precedence over everything else,
Right.
stabilization comes first,
Yeah.
even if it means a closer hospital. That's not a designated stroke center.
So again, stabilization before specialization.
Right.
But here's a twist.
Okay.
If the stroke symptoms vanish before paramedics arrive,
Mm-hmm.
the protocol is off.
Mm-hmm.
You'd think any stroke symptoms,
Right.
even fleeting ones, would be cause for concern.
Great point.
Yeah.
And it highlights the complexity of stroke diagnosis.
Okay.
Sometimes people experience what's called a transient ischemic attack,
Okay.
or TIA.
Gotcha.
Think of it as a temporary blockage of blood flow to the brain.
Okay.
Symptoms mimic a full-blown stroke, but typically disappear within minutes or hours.
Right.
However,
Yeah.
a TIA is a major warning sign
Right.
that a more serious stroke could be on the horizon.
So even though the immediate danger is gone,
Yeah,
getting checked out is crucial to
Yeah.
prevent a future stroke.
absolutely.
Right.
TIAs often signal underlying problems like narrowed arteries
Yeah.
or an irregular heartbeat,
Ugh,
things that need attention.
makes sense.
Yeah.
What about low blood sugar mimicking a stroke?
Right.
That sounds strange.
It does,
Yeah.
but it happens more often than you'd think.
Oh, really?
When blood sugar plummets,
Okay.
the brain doesn't get the glucose it needs to function properly.
Okay.
This can cause confusion, weakness,
Right?
slurred speech,
Yeah.
even seizures, which can easily be mistaken for a stroke.
So checking blood sugar is crucial.
Yes.
And I see they also mention seizures and coma as disqualifiers for the stroke protocol.
Those are complications that muddy the waters,
Right.
often requiring a different approach than the stroke protocol.
Okay.
They could be symptoms of something else entirely,
Right.
or complications related to the stroke itself.
Gotcha.
Either way,
Mm-hmm.
they need further investigation and specialized care.
Okay. That's starting to paint a clearer picture
Yeah.
of how these protocols work in the real world.
Yeah.
But there's one more thing I wanted to bring up. That note in both protocols about long transport times,
Mm-hmm.
sometimes it seems like the closest hospital
Yeah.
isn't always the best choice.
You've hit a crucial point,
Oh, really?
and it gets at the heart of the balancing act
Okay.
paramedics face
Yeah.
in these time-sensitive situations.
All right.
Yeah.
Okay,
Yeah.
right. It's like a high-stakes puzzle,
Right.
and they're working against the clock.
Right.
Sometimes those decisions defy common sense,
Mhm.
like with the transport time issue.
Yeah.
It seems counterintuitive that a longer ambulance ride could be better,
Right. Okay.
but it all comes down to matching your needs
Right.
with the resources available at each hospital.
Like that thing about respiratory distress,
Right.
disqualifying someone from the STEMI bypass.
Yeah.
On the surface, you'd think they can't breathe.
Yeah.
Get them to the closest hospital and NALBU.
Yeah. Yeah.
But the logic is, if they need a ventilator,
Maybe the cardiac center isn't equipped to handle that immediately, and those precious minutes lost could make a difference.
right, it's about stabilization first,
Right.
specialization second,
Well,
and it's reassuring to know
Yeah.
that paramedics aren't out there making these tough calls in isolation.
okay.
They've got a direct line to expert backup,
Right.
those central ambulance communication centers or services.
Okay, so they can run the situation by someone else.
Yeah,
Get a second opinion
Yeah.
from folks who have the big picture view
right,
of all the hospitals and their capabilities.
exactly.
It's a team effort,
It is.
which makes sense when you're dealing with something
Mm-hmm.
as critical as a potential heart attack or stroke.
Absolutely. And it's not just about like blindly following a checklist. These paramedics are using their judgment,
Right.
their experience,
Yeah.
combining that with the information from these prompt cards and the guidance from medical control.
Right.
It's a remarkable balance
Mhm.
of science and human intuition.
So what we've gleaned from these prompt cards is just a glimpse into that complex world.
Right.
There's so much more that goes into those
Yes.
split-second decisions
Mhm.
that ultimately could save your life.
And what's even more mind-boggling
Oh, yeah.
is that these protocols aren't static.
Right.
They're constantly evolving
Right.
as medical knowledge and technology advance.
Yeah.
Think about it.
Yeah.
What might these prompt cards look like
Wow.
in 5-10 years?
Ooh, good question. Could we see AI algorithms assisting paramedics
Potentially.
in real time,
Mhm.
analyzing patient data
Yeah.
and suggesting the optimal course of action?
Possibly.
Or maybe personalized protocols based on your genetic predispositions or even your past medical history.
The possibilities are truly mind-blowing.
Yeah.
Yeah. It really is.
It's amazing to think about how these protocols might change in the future.
Yeah.
But for now,
Right.
you've gained some valuable insights
Hopefully.
into the world of emergency protocols
Mm-hmm.
and the dedicated individuals who use them
Yes.
to navigate those life or death situations.
Absolutely. And while we hope you never need these protocols in action,
Right.
understanding them gives you a newfound appreciation
Yeah.
for the complexity of emergency medical care
Right.
and the incredible people who are there for us when we need them most.
Well said.
Yeah,
Thanks for joining us
of
for
course.
this deep dive
My pleasure.
into emergency protocols.
Yeah,
Until next time, stay curious,
absolutely.
stay informed,
He's
and
right.
stay safe out there.
Yes, be safe.
All right. Thanks.
All right. Sometimes the decision-making shifts from purely medical to
Right.
logistical stabilizing you at a closer hospital,
Okay.
even if it doesn't have all the specialized equipment. Might be better than risking your condition worsening
Yeah.
during a long transfer.
So it's like weighing the benefits of specialized care
Exactly.
against the potential risks of delay.
Against the risks of delay.
But I imagine that's a tough call for paramedics to make
Yes.
in the field, especially under pressure.
Absolutely. That's why they aren't making these decisions alone.
Okay.
They have a direct line
Excellent.
to experts at what's called the Central Ambulance Communications Center or
Right.
Ambulance Communications Service,
Right.
CTC or ACS for short,
Exactly.
depending on the region.
So they've got backup people they can consult with
Yeah,
who have a broader view of the situation.
exactly. Paramedics relay all the information they've gathered,
Right.
your symptoms,
Right.
your vital signs,
Mm-hmm.
estimated transport times to different hospitals.
Okay.
And the CAC or ACS helps weigh the options,
Right.
guiding them to the most informed decision
Right.
for your specific case.
That's reassuring to know.
Yeah.
It's not just one person making those critical decisions.
It's a team effort,
Right.
which makes sense when you're dealing with something as serious as a potential heart attack or stroke.
Right.
And it highlights that even with these protocols, every case is unique.
Okay.
There's no substitute for critical thinking,
Right.
clear communication,
Mhm.
and a deep understanding of the medical situation.
So it's not just about following a script.
Exactly.
It's about using judgment and experience, adapting to the situation at hand.
Precisely. These protocols are incredibly valuable tools,
Yeah.
but they're just that. Tools.
Yeah.
They can't replace the human element
Okay.
of emergency medical care.
It's been fascinating to peel back the layers on this.
Yeah.
We've learned that what seems like a straightforward emergency,
Right.
a heart attack or a stroke,
Mm-hmm.
is actually incredibly complex.
Yes.
Paramedics are doing much more than just driving fast.
Right.
They're making carefully calculated decisions.
They are.
That could mean the difference between life and death.
It truly is a testament to their skill and dedication.
Right.
They're on the front lines of healthcare,
Mm-hmm.
making critical decisions in those crucial moments.
So let's recap the key takeaways
Okay.
for our listeners today.
All right.
First, we learned that seemingly straightforward medical emergencies,
Yeah.
like heart attacks and strokes,
Right.
actually have hidden complexities.
Uh-huh.
Paramedics are trained to quickly assess
Right.
and navigate these complexities.
Yeah.
Second, while time is critical,
Mm-hmm.
sometimes getting to the right CFD hospital,
Yes.
even if it's farther away,
Yes.
is paramount.
It is.
And finally, clear communication between paramedics and medical control
Yes.
is crucial in making sure you get the best possible care.
That's a great summary.
Okay?
These protocols are a fascinating mix
Right.
of science, logistics,
Mhm.
and on-the-spot decision-making,
Right.
all working together to get you the right care at the right time.
And as a final thought for our listeners,
Okay.
these protocols are constantly evolving
Yeah.
as medical knowledge and technology advance.
Mm-hmm.
It makes you wonder
Yeah.
what other factors might influence future emergency protocols.
It's an exciting question to consider.
Right.
The possibilities are truly mind-blowing.
Well said.
Yeah.
Thanks for joining us
Of course.
for this deep dive into emergency protocols.
Yeah, my pleasure.
Until next time,
Hey.
stay curious,
Yeah.
stay informed,
Inform.
and stay safe out there.
Yes, be safe.
All right, thanks.
Right.
It's fascinating, isn't it?
It is.
You think heart attack or stroke, and you
Yeah.
imagine it's a clear-cut situation.
Yeah.
Get into the hospital ASAP.
Yeah.
But there's this whole layer of decision-making we don't see
Right.
where paramedics are like detectives
Yeah.
piecing together clues to make sure you get the right care,
Yeah.
even if it means a slightly longer trip.
Exactly.
It's like a high-stakes puzzle.
It is.
And they're working against the clock.
They are.
Sometimes those decisions
Right.
defy common sense,
Yeah.
like with the transport time issue.
Yeah.
It seems counterintuitive
It does.
that a longer ambulance ride could be better,
Yeah.
But it all comes down to matching your needs
Right.
with the resources available at each hospital.
Exactly.
Like that thing about respiratory distress,
Right.
disqualifying someone from the STEMI bypass on the surface, you'd think
Right.
they can't breathe,
Right.
get them to the closest hospital, NLW.
Yeah.
But the logic is, if they need a ventilator,
Right.
maybe the cardiac center isn't equipped
Yeah.
to handle that immediately.
Exactly.
And those precious minutes lost could make a difference.
Right. It's about stabilization first,
Right.
specialization second.
Exactly.
And it's reassuring to know
Yeah.
that paramedics aren't out there making these tough calls in isolation. They've got a direct line to expert backup,
Right.
those central ambulance communication centers or services.
So they can run the situation by someone else.
Yeah.
And a second opinion
Yeah.
from folks who have the big picture view
Right.
of all the hospitals and their capabilities.
Exactly.
It's a team effort,
It is.
which makes sense when you're dealing with something
Yeah.
as critical as a potential heart attack or stroke.
Absolutely. And it's not just about blindly following a checklist.
Right.
These paramedics are using their judgment, their experience,
Sure.
combining that with the information from these prompt cards and the guidance from medical control.
Right.
It's a remarkable balance of science and human intuition.
So what we've gleaned from these prompt cards
Yeah,
is just a glimpse into that complex world, right?
precisely.
There's so much more that goes into those split-second decisions
Yeah.
that ultimately could save your life.
And what's even more mind-boggling is that these protocols aren't static. They're constantly evolving as medical knowledge and technology advance.
Right.
Think about it. What might these prompt cards look like in 5, 10 years?
Ooh, good question.
Yeah.
Could we see AI algorithms assisting paramedics in real time,
Potential.
analyzing patient data
Yeah,
and suggesting the optimal course of action?
possibly.
Or maybe personalized protocols based on your genetic predispositions,
Interesting.
or even your past medical history.
The possibilities are truly mind-blowing.
It's amazing to think about how these protocols might change in the future.
Yeah.
But for now, you've gained some valuable insights into the world of emergency protocols
Hopefully.
and the dedicated individuals who use them to navigate those life or death situations.
Absolutely. And while we hope you never need these protocols in action,
Right.
understanding them gives you a newfound appreciation for the complexity of emergency medical care
Right.
and the incredible people who are there for us when we need them most.
Well said.
Yeah.
Thanks for joining us for this deep dive into emergency protocols.
My pleasure.
Until next time, stay curious, stay informed, and stay safe out there.
Yes. Be safe.
So we've established that
Yeah.
longer transport times can sometimes be the better option,
Mm-hmm.
even if it seems counterintuitive.
Right.
Can you walk us through the logic behind that?
Of course.
Um,
So sometimes the decision-making
Okay.
shifts from purely medical to logistical,
Right.
stabilizing you at a closer hospital,
Right.
even if it doesn't have all the specialized equipment,
Yeah.
might be better
Okay.
than risking your condition worsening during a long transfer.
So it's like weighing the benefits of specialized care
Uh-huh.
against the potential risks of delay.
Exactly.
But I imagine that's a tough call
It is.
for paramedics to make in the field,
Yeah,
especially under pressure.
absolutely.
Right.
That's why they aren't making these decisions alone.
Okay.
They have a direct line to experts at what's called the Central Ambulance Communications Center or Ambulance Communications Service,
Right.
CACC or ACS for short,
Right.
depending on the region.
So they've got backup
They do.
people they can consult with
Yeah,
who have a broader view of the situation.
exactly.
Yeah.
Paramedics relay all the information they've gathered,
Okay.
your symptoms, your vital signs, estimated transport times to different hospitals,
Okay.
and the CACC or ACS helps weigh the options,
Right.
guiding them to the most informed decision for your specific case.
That's reassuring to know.
Yep.
It's not just one person making those critical decisions.
It's a team effort,
Wow.
which makes sense
Yeah.
when you're dealing with something as serious as a potential heart attack or stroke.
right.
And it highlights that.
Yeah.
Even with these protocols, every case is unique.
Mm-hmm.
There's no substitute for critical thinking,
Right.
clear communication,
Yeah.
and a deep understanding of the medical situation.
So it's not just about following a script. It's about using judgment and experience,
Right.
adapting to the situation at hand.
Precisely.
Right.
These protocols are incredibly valuable tools,
Yeah.
but they're just that, tools.
Right.
They can't replace the human element of emergency medical care.
It's been fascinating to peel back the layers on this.
It has.
We've learned that what seems like a straightforward emergency,
Right.
a heart attack or a stroke,
Uh-huh.
is actually incredibly complex.
It is.
Paramedics are doing much more than just driving fast.
Yeah.
They're making carefully calculated decisions
Right.
that could mean the difference between life and death.
They are making life and death decisions.
Yeah.
It truly is a testament to their skill and dedication.
Yeah.
They're on the front lines of healthcare, making critical decisions in those crucial moments.
So let's recap the key takeaways for our listeners today.
Right.
First, we learned that seemingly straightforward medical emergencies,
Yeah.
like heart attacks and strokes, actually have hidden complexities.
Right.
Paramedics are trained to quickly assess and navigate these complexities.
Right.
Second, while time is critical,
Yeah.
sometimes getting to the right T hospital, even if it's farther away,
It might be.
is paramount.
Yes, it is.
And finally, clear communication between paramedics and medical control
Uh-huh.
is crucial in making sure you get the best possible care.
That's a great summary.
Okay, good.
These protocols are a fascinating mix
Right.
of science, logistics, and on-the-spot decision-making,
Right.
all working together to get you the right care at the right time.
And as a final thought for our listeners,
Okay.
these protocols are constantly evolving.
They are.
As medical knowledge and technology advance,
Right.
it makes you wonder what other factors
Yeah.
might influence future emergency protocol.
It's an exciting question to consider.
Right.
The possibilities are truly mind-blowing.
Well said. Thanks for joining us
My pleasure.
for this deep dive into emergency protocols.
Yeah.
Until next time,
All right.
stay curious, stay informed.
And stay safe out there.
Yes, be safe. Okay, so today we're going to kind of dive into something pretty intense.
Yeah.
Paramedics and sexual assault.
Mm-hmm.
And, obviously it's a very sensitive topic.
For sure.
But like we always do, we're going to be looking at this, from the perspective of the guidelines
Absolutely.
and how those guidelines try to balance all these different factors.
Yeah.
So I've been, reading through some of these official guidelines for paramedics, and I got to say, like, some of this stuff really surprised me.
Oh, yeah.
I mean, it's way more complicated
Oh, sure.
than I ever thought it would be.
Mm-hmm.
And I'm really glad that we have you here to help break down all this information for us.
Absolutely happy to be here.
So just from a broad perspective,
Yeah.
I was really struck by this idea of how paramedics are trying to walk this really fine line between respecting the victim's wishes,
Right.
but then also making sure that potential evidence is preserved.
Absolutely.
That can't be easy.
Yeah. No, it's a very tough thing to do.
So, I'm curious, when you look at these guidelines, what to you stands out as the most important thing for the victim's experience?
I think one of the things that really jumps out at me is just that right away they're saying, you never leave this person alone.
Oh,
Never leave a patient who's reporting a sexual assault alone.
Mhm.
Because think about it, you're in this incredibly vulnerable moment.
Right.
You're probably in shock. There's all this trauma.
Yeah.
And just having somebody there consistently can be so grounding.
Makes sense.
Yeah.
Yeah, just that sense of
Mm-hmm.
okay, I'm not alone.
Right.
Somebody's here with me.
Exactly. Somebody's here for me.
And that kind of makes me think, too, about situations where, the victim is particularly vulnerable,
Mm-hmm.
and thinking about children,
Right.
because the guidelines do address this specifically.
Yeah, they do.
Right.
And it shifts the focus to really understanding a child's specific needs and vulnerabilities.
So it's not just a blanket okay,
Yeah.
this is what we do for everybody.
Yeah.
There are special procedures for kids.
Absolutely.
Wow.
Yeah, so reporting the assault is different, obviously, making sure that the child is safe and that their well-being is protected,
Hmm.
and then making sure that they're connected with, special support services that are designed for children.
Yeah, because a child might not be able to advocate for themselves in the same way that an adult can.
Exactly. That's exactly right.
So it's an extra layer of protection.
Absolutely.
Wow.
Yeah.
And this leads to something else that I thought was really interesting, and that is that the guidelines say that paramedics should offer to contact the police,
Yeah.
but then they also have to respect the patient's wishes if they don't want involves law enforcement.
Right.
I mean, that seems like such a tough situation.
It is a really difficult balance. You have to balance encouraging someone to report
Mm.
with respecting their autonomy.
Right.
And there are lots of reasons why someone might not want to involve the police. Maybe they're afraid, maybe they've had bad experiences in the past, maybe it's a personal thing.
Right.
But it's so important that their decision is respected.
Yeah.
At the same time, you want to make sure that they know what their options are, and what the potential benefits of reporting might be.
Yeah.
Things like getting support services
Mm-hmm.
or even potentially taking legal action.
Right.
So it's tricky.
It's about empowering them with information
Right.
and then letting them decide what's right for them.
Absolutely.
Wow. Another thing that really stood out to me was, and this was a very specific detail.
Yeah.
It was the instruction to bag certain materials if the police request it.
Mm-hmm.
Now, why is that so important?
That comes down to preserving evidence.
Okay.
And it might not be obvious, but even things like the linen on the stretcher or the bandages that they use, those could have DNA on them.
Oh, geez, I never even thought about that.
Yeah, or other traces of what happened.
Wow.
And those can be really important for investigators.
Yeah.
So the paramedics have a crucial role in collecting and preserving those materials.
So it's like they're almost like part of the investigative team in a way.
In a way, yeah, absolutely.
It really makes you realize like how much is going on behind the scenes
Yeah, it really does.
that we just don't even think about.
Right.
And then before we wrap up, I wanted to touch on one last thing from the guidelines,
Okay.
and that's the idea of discussing local resources with the patient.
Mm-hmm.
What kind of support networks are typically available?
Well, thankfully, there's a lot out there.
Okay.
There are sexual assault crisis centers, there's counseling services, legal aid, advocacy groups,
Wow.
and paramedics can really help connect victims with those resources,
Yeah.
which can be so important for healing.
Yeah, that's great.
Absolutely.
Well, thank you so much for sharing your expertise with us. This has been really eye-opening.
Happy to help.
It's a complex and sensitive issue, and it's something that, most of us don't really think about very often.
Right.
And to our listeners out there, thank you for joining us on this deep dive. You've given us a lot to think about, and hopefully this has helped you understand, the complexities of this sensitive issue a little bit better.
Yeah.
And before we go, I just want to leave you with something to ponder.
Okay.
We've learned a lot about how paramedics try to balance respecting a victim's wishes and the need for evidence. So how might we do a better job of informing the public about these procedures?
Right.
I mean, could greater awareness help people feel more empowered to make informed decisions in what is just a really, really difficult situation?
Yeah, absolutely. That's a great question to think about.
Thanks again.
My pleasure.
All right, we'll see you next time.
See ya.
Okay, so have you ever thought about what happens when a paramedic, they're out there and something crazy's happening, right? They've got to make a decision fast.
Yeah.
But maybe the textbook way of doing things just isn't the best option in that moment.
Yeah, that's a really interesting point.
Right. That's what we're going to dive deep into today.
Sounds good.
How paramedics here in Ontario can actually sometimes work outside the typical guidelines for care. And you sent us some information about research trials involving paramedics.
Right.
This is some pretty cutting edge stuff.
Yeah, it's pretty cool. So typically the Ministry of Health here in Ontario, they set really clear standards of care for paramedics, the rules, the protocols that they follow every day.
Right.
And this is really interesting, there's an exception that the ministry can actually approve deviations from those standards.
Wait, so you're telling me that there are times when paramedics don't have to strictly follow the rules?
Yeah, in very specific situations.
Okay, so that's a pretty big deal. So when can they actually do things differently? And how do we know that's still safe for the patient?
That's a great question. And it all comes down to approved research trials. So basically, paramedics can be a part of research studies where they try out new ways of caring for patients.
Okay.
It's kind of like when they test a new medicine or new treatments.
Right, yeah, like a clinical trial.
Exactly. And the Ministry of Health has a really rigorous process for approving these trials. They just don't approve everything. Patient safety is paramount. It's their absolute top priority.
Okay, so they're not just winging it. There's a whole system in place, the ministry's kind of overseeing it all. So let's say, I'm out there, I'm a paramedic in the fields, I'm thinking, okay, a procedure from one of these research trials might be the best choice for my patient in this moment. What do I absolutely need to make sure of before I even consider doing anything differently?
That is a really great question. And there are 3 specific conditions that need to be met. So first, the Ministry of Health needs to have already approved the specific alternate standard of care.
Okay.
That means it's officially recognized as a valid option. It's different from the usual way, but it's been given the okay.
Got it.
And
So the ministry's already signed off on this. What's next?
second, the research trial itself needs to have been approved by a research ethics board.
Okay.
So this is like a committee that makes sure that the study is ethical and that it's going to protect everyone who's participating in it. They make sure that it meets all of the requirements of, national ethical guidelines
Right.
and, follows all the privacy laws like FIPA.
So it's not just the ministry. There's this like whole other group of people making sure things are being done the right way.
Exactly.
Okay, what's the third condition?
So the third one involves getting review and written support from the Ontario-based Hospital Group Medical Advisory Committee.
Wow, it's a mouthful.
It is a mouthful, but essentially this is a committee of experts who are overseeing paramedic practices for the whole province. So they're really making sure that, things are safe and effective.
So you've got the ministry, you've got this ethics board, and you've got like a committee of experts all kind of like signing off, making sure that this research is legitimate.
Yes, exactly.
Okay, wow, that's a lot of checks and balances.
Mm-hmm.
It sounds like patient safety is like the #1 goal.
Absolutely.
But let's not forget about the patient, right?
Yeah.
They're the ones actually getting this new care.
Right. And that brings us to informed consent.
Right.
So just like with any other medical procedure, paramedics have to get informed consent from the patient before including them in the research trial.
Okay.
They need to explain the potential benefits, the potential risks, and really make sure the patient understands everything before agreeing. And just to be clear, that's separate from, the normal consent that they would get for any kind of care, right? They need to get consent under the Healthcare Consent Act regardless. Right, of course.
So this is like an additional layer
Additional consent. Right.
for this specific research trial.
Got it. Okay. So let's say all the boxes are checked. The trial is approved, the ethics board is happy, the expert committee has given the green light, and the patient is like, yeah, let's do this. What happens then?
Then the paramedic can provide care according to the research trial's protocol.
So there you have it. There's this really interesting system that lets paramedics use new and potentially life-saving procedures, but only under these super specific conditions.
Right.
I mean, we're talking multiple levels of review, getting expert opinions, and of course the patient is consenting every step of the way.
Absolutely.
It's like a delicate balance between pushing the boundaries of medicine, but also protecting people.
Yeah, and it's important to remember this isn't just about trying new things. It's about making sure that those new things are actually effective and that they're going to lead to better care for everyone.
Of course, yeah.
But it does raise some, I don't know, thought-provoking questions. Like what?
Well, how do you balance the need to move quickly in an emergency
Right.
with the time it takes to get all of these approvals in place? It's not, an easy thing to figure out.
Yeah, that's a really good point. It makes you kind of take a step back and appreciate all the work that goes in to making sure that these new treatments are safe and effective for everybody.
Right.
Well, hey, thanks for joining us for this deep dive.
My pleasure.
It's given us all a lot to think about for sure.
It has.
All right, see ya.
See you later.
Bye.
Bye.
Okay, so you know how we always talk about those crazy intense emergency situations?
Right.
Yeah, well, today we're going even deeper
Oh, wow.
into the communication side of things.
Okay.
You know those paramedics in the ambulance?
Yeah.
They have to be on point with how they talk to everyone,
Makes sense.
like the hospital they're rushing to or even a doctor over the phone.
Oh, right. So they don't just show up and be like, surprise, here's a patient.
Ha, exactly.
That would be
Chaos.
total chaos. But yeah, that's what this whole paramedic reporting standards thing is all about.
Interesting.
And we've got some sources here, actual guidelines they have to follow.
Oh, wow, real deal stuff.
So yeah, we're going to break it down and say,
Right.
look at the reports they send to the hospital and those calls they make to doctors.
Cool, so a behind-the-scenes look at how it all works.
Exactly. Because clear communication can actually, make the difference in those situations.
No pressure then.
Haha, right.
Yeah.
But let's start with those reports to the hospital, especially for the most urgent cases. Oh, yeah, those got to be top priority.
Totally. And, the rules say they have to report while they're still on the way to the hospital for those really critical patients.
Okay, so right away.
Yeah, no time to waste. And those are specifically for CTAS 1 and 2 patients.
No, what's CTAS again?
Oh, right. Good point. It stands for the Canadian Triage and Acuity Scale.
Okay, so it's like a way to figure out how bad someone's condition is.
Exactly. It's standardized so everyone knows what's what.
Smart makes things way easier.
Yeah, and CTAS-1 is like the most critical, think major heart attack or like a really bad head injury.
Oh, wow. So time is absolutely crucial.
Totally. And CTAS-2 is still urgent, but they might be able to wait a little bit for treatment.
Gotcha. So like still serious, but not quite as immediately life-threatening.
Right. So picture this, paramedics are racing to the hospital with a CTAS-1 patient.
Oh, okay. Heart-pounding stuff.
Yeah, and they're trying to give the hospital all the info they need while also like keeping this person alive.
Multitasking on a whole other level.
Right. So what exactly do they need to tell the hospital in that initial report?
Well, first they got to say who they are, so their unit ID.
Oh, right. So the hospital knows who's coming.
Yep. Then basic info about the patient, like their name, age, all that.
The basics.
And of course, that CTS level.
Got to make sure the hospital knows how urgent it is.
Exactly. Then they go into more detail what's wrong with the patient, so their chief complaint.
Makes sense. Got to give them a quick summary of what's going on.
Right. Then a bit about the patient's history, like any relevant medical conditions.
Oh, so they have some context.
Yep. And then any key findings from their assessment, like what they see and hear.
So like how the patient looks and sounds.
Exactly. Then they tell them what they've done so far, any medication or treatment they've given.
Makes sense. Got to keep everyone in the loop.
Right. And that's called management provided in the report.
Ah, okay. And how the patient responded to that treatment.
Right. So they know if it's working or not.
Wow. It's like a whole mini medical record right there.
It kind of is, but all squeezed into a quick report.
So why is all that detail so important?
Well, imagine you're the receiving team at the hospital.
Okay.
Every bit of info helps you get ready for this patient.
Like a heads up.
Exactly. For example, if the paramedics say the patient's heart rate is all over the place.
Oh, that's not good.
Right. That could mean the patient is getting worse, so the team might call in a heart specialist or get an operating room ready.
Oh, wow. So they can jump into action right away.
Exactly. They got to be prepared.
Makes sense. It's like putting together a puzzle, but with really high stakes.
That's a great way to put it.
And of course, they also need to give the patients vital signs like their pulse and breathing.
Right. That's crucial.
And probably the most important thing, their estimated time of arrival.
Oh, yeah. Got to know when to expect them.
So the hospital can have everything ready when they pull up.
Right. Exactly.
Now, you mentioned earlier that the hospital has to acknowledge they got the report.
Yeah, that's key.
Why is that confirmation so important?
It's like closing the loop. You
Yeah.
know, making sure everyone's on the same page.
Okay, like a "we hear you were ready" kind of thing.
Exactly. And if anything changes with the patient.
Like if they get worse.
Right. Then they send another report right away.
So it's not just a one-time thing.
Nope. It's a constant conversation.
Now let's switch gears and talk about those calls to the doctor. The patch-to-base hospital calls.
Ah, yes. Those are interesting.
It's amazing how they can just call a doctor while they're in the ambulance.
Technology is pretty wild.
So when do they actually need to make those calls?
Well, it means they need help from a doctor.
Like they're not sure what to do.
Right. Sometimes there's specific rules, like needing a doctor's okay to give certain medications.
Wow, that makes sense.
But sometimes it's just about judgment if the paramedic isn't sure what's best.
They can call for backup.
Exactly. It's like having an expert on call.
So what do they say during those calls?
Well, first they got to tell the doctor what level of paramedic they are.
Oh, right. So the doctor knows what they're qualified to do.
Exactly. Then they give a detailed report on the patient, kind of like what they send to the hospital.
But even more in depth.
Yeah, because the doctor needs all the info to make a good decision.
So the doctor can be like miles away, but still know exactly what's going on.
Right. It's like they're right there in the ambulance.
What happens after the report?
The doctor might ask questions or give advice or specific instructions.
Okay.
This is super important. The paramedic has to repeat back all the instructions and orders to the doctor.
So there's no confusion.
Right, especially in those high-stress situations.
Where every word matters.
Exactly. Got to make sure everyone's on the same page.
And I'm guessing all of these conversations are documented somewhere.
Oh, you bet. Every single detail is written down.
Why is that so important?
Well, it's not just about following rules.
Okay.
It's about making sure the patient gets the best possible care.
How so?
Because those records show exactly what happened, what decisions were made, and what actions were taken.
Oh, I see. So anyone else involved in the patient's care can see the whole story.
Exactly. It's all about continuity of care.
So we've learned about the two main ways paramedics communicate those reports to the hospital and those calls to the doctor.
Both super important.
And they're both designed to make sure the right info gets to the right people.
Right, which ultimately leads to better care for the patient.
Now, it makes me wonder how all this will change as technology keeps advancing.
That's a good question.
Like, will we see ambulances sending live data directly to the hospital?
Oh, that would be cool.
Or maybe AI could help paramedics make decisions in those critical moments.
Who knows? The possibilities are endless.
Definitely something to think about. Well, thanks for joining me for this deep dive into the world of paramedic communication.
It's been my pleasure.
It's clear that clear communication is absolutely vital in those emergency situations.
It can literally save lives.
No doubt about it. Thanks again.
Anytime.
And to all our listeners out there, stay safe, and thanks for tuning in. Okay, so you guys sent in this document. It's about seizure protocol for paramedics.
Right.
And wow, there's a lot to it.
Yeah.
I was kind of surprised just how much goes into responding to somebody having a seizure. So, it's a good thing we're diving deep into this because this is, life or death stuff.
Absolutely.
I mean, we're talking serious business here, right?
Yeah, so first off, maybe we should define what exactly is a seizure.
Yeah, that's a good point.
So basically it's like an electrical storm in the brain.
Okay.
These sudden bursts of electrical activity, they can really impact behavior and movement and even awareness.
So if you're a paramedic, you show up on scene and somebody's having a seizure.
Yeah.
I mean, what's going through your mind?
Well, the first thing, and the document really emphasizes this, is you got to look beyond the seizure itself.
Right.
You're like a detective, looking for clues, because a seizure can be a symptom of something much bigger.
Oh, wow.
There's a ton of possibilities like stroke or low blood sugar, even
Yeah.
problems specific to certain age groups.
So it's not just about stopping the seizure. You have to figure out, what's causing it.
Exactly. You have to get to the root of the problem.
That's amazing.
Yeah, like let's say your patient's pregnant or just had a baby.
Okay.
A seizure could be a sign of eclampsia.
Eclampsia.
Yeah, it's a serious complication that can cause seizures, coma, even death
Wow.
for both the mother and baby.
Oh, my gosh.
So, getting a good medical history is super important.
Okay, so that's a lot to think about. But the seizure's still happening, so what are you doing right then and there?
Well, you got to protect the person while you're gathering information,
Okay.
The recovery position is key.
Okay.
It keeps their airway open so they don't choke or aspirate,
Aspirate meaning?
inhaling vomit.
Oh.
Obviously, you also want to prevent injuries, from falls or hitting something.
So you're really actively working to keep them safe.
That's right. And all the while, you're carefully watching the seizure itself.
Like, what are you looking for specifically?
Well, things like eye movement,
Like, what do you mean by eye movement?
like which direction they're looking. If their eyes are deviated, it can tell you
Oh,
which part of the brain the seizure's coming from.
I had no idea.
It's a clue, you
Right.
know? And then there's incontinence. Are they jerking or stiffening? What kind of seizure is it?
All important details.
Yeah, every little thing can help paint a picture.
Okay, so let's say the seizure stops. What happens next?
Then you move on to the secondary survey.
Secondary survey.
It's where you do a head-to-toe assessment looking for any injuries that might not be obvious.
So beyond the bitten tongue,
Right, exactly. It could be anything from a fall or something internal. You really have to be thorough.
It's like putting together a puzzle, right?
Yeah, exactly.
yeah.
You're trying to get the full story.
And all this information is going to inform, what happens next.
Exactly. Like, let's take incontinence, for example.
Okay.
It comes up in both these active seizure section and the secondary survey.
Oh, interesting.
It might seem like a small thing, but it can really tell you a lot about what happened during the seizure and help guide your next steps.
I see.
It's all connected.
So, okay, you've dealt with the immediate situation. You've checked for injuries. What now?
Now you're thinking ahead, anticipating problems that might come up.
Oh, like what?
Well, for one, the airway can still be compromised,
Right, because...
from the tongue relaxing or aspiration.
Right.
And you're always on the lookout for another seizure. They can happen back to back sometimes.
Oh, gosh.
And then there's the post-ictal state.
Post-ictal?
It's that period right after a seizure. It's super unpredictable. Some people are confused. Some are combative and agitated.
Oh, wow.
It can be pretty intense.
So you really got to be ready for anything.
Absolutely. You're always one step ahead,
Wow, this has been so fascinating. I mean, it really makes you appreciate what paramedics do.
For sure. It's not easy.
So for our listeners out there, what's the big takeaway here?
I think it's understanding that seizures are a lot more complex than they seem. It's not just about stopping the shaking. It's about observation, quick thinking, and anticipation.
Yeah, and it makes you think, what can you do if you see someone having a seizure?
That's a good question to consider.
Absolutely. Well, thanks for joining us on this deep dive. And as always, stay curious.
Thanks for having me.